Recording in progress.
Okay, we good? We'll let Ann, yeah, it doesn't have it. And I don't, you might have checked. Check, because, right. Okay, we ready? Very good. Okay, terrific. Good afternoon, everyone. Today is January the 14th, 2026. It is 3:52. And as a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Strategic Planning Committee. As a reminder, the committee members may also be participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have legally compliant meetings at all times. I would like to announce that in order to make it more accessible to the community members, we will now hold public comment or public communications for the Strategic Planning Committee, Infrastructure Committee, and Executive Committee meetings. Do we have anyone who has signed up for any comments of any of these meetings? We have none. So with that, I'll go ahead and proceed. You'll see in your first committee item agenda, you have the review and approval of the minutes of the December 10th, 2025 Strategic Planning Committee. If you've had a chance already to review your minutes, I'd be happy to take a motion to adopt the minutes.
Only your board members can make the motion.
Only the committee members. Right, so committee members?
Anyone can make motions to vote, so what that counts.
Oh,
Yeah, only the committee members can vote.
Yeah?
okay,
Says that in
okay.
Robert's rules?
Okay, so we've heard from legal. They've said that we can get a motion from any one of us around the table that are members of this board. So may I please have a motion to adopt them? Manager Valadez moves and Manager Martin seconds the adoption of the minutes. Thank you very much. And let me just say one more thing. I was a little remiss. We do have a new board member, Sadora Jefferson. She's a member of this committee, and she will be more formally introduced at the next meeting of the Executive Committee. But thank you, Sadora, for being with us. We're happy that you're here, and I'm sure you'll engage with us appropriately as it would go. Thank you very much. Okay, number two. Oh, sorry. First meeting under my helm. Okay, all those in favor of the adoption of the minutes as presented, please signify by saying aye, and the voting members will be the members of this committee. Aye. Aye. And, okay. You're a member.
Oh,
Yeah,
again? I'm back on it?
yeah.
Okay.
Thank you. All right, all those, okay, it passes, unanimously passes. Thank you. Now we have Dr. Lee.
It's a point of privilege, if I may. On behalf of staff, we want to extend
Dr.
our...
Lee, we're going to do that, pardon me, not to
okay.
be rude, we're going to do that in the executive committee level.
Oh, excuse me. Apologies.
Okay, all right, sorry. It's coming, it's all coming. Okay,
Chair?
let me yes.
Just really quick, you may have this item for next meeting, but could you, for full transparency, send out who's on which committee? Because committee assignments, if possible.
Yeah.
Thank you.
Yes, we'll talk about that in the executive committee. Yeah.
It just happened that the order of this meeting fell such that it feels a little disjointed. I apologize for that. Yeah, sorry about that. Look, it's our first meeting coming together, so just be a little patient with everybody and a little grace all along the way. That'll move us forward really fast. Okay, so the second item, discuss and take appropriate action on the resolution providing board guidance to staff regarding Central Health Systems transformation strategic plan. Monica Crowley will be presenting. Thank you, Monica.
And Chair May, if I may, just a brief bottom line up front on this particular topic. The mic is very active. So managers, as we know, we're reviewing today a discussion of a body of work that we have reviewed several times over the recent months regarding the direction and path ahead and the process for planning for that path. Last year, we presented versions of this and received feedback from a number of board members that we have worked hard to incorporate into this version under Vice Chair May's direction here. And so hopefully you will see that language reflected in the resolution that's before you this evening. This iterative process includes track changes so we can all see that progression. And we are seeking tonight any final feedback from the committee so that we can put forward a consolidated resolution for the board's consideration on the 28th and get going with the strategic planning process. So we're excited for that. We appreciate Vice Chair May, your leadership in particular in moving us forward right out of the gates at the beginning of the year. And so with that, over to you, Monica. Thank you.
Thank you. Yes,
Thank
ma'am.
you, Chair May. And Pat, as he noted, next slide, please. We began these discussions with the board in November, and the themes that we noted from that November presentation include the need to clarify strategic planning architecture, that the health equity plan is an anchor but still needs updating, that the board wants to provide direction first, and then the staff will provide drafts, like planning to be accelerated and to agree on success measures as we move into the strategic planning process. We took that feedback from the November meeting and on December 10th brought forth a strategic transformation draft policy and strategic plan framework that we again received feedback from the board on. There seemed to be general agreement that the board direction related to system transformation strategic planning was appropriate, but that was not at a level of a policy, but that was more at a level of a resolution. So if you notice, the format in front of you today is in the format of a resolution. We needed to clarify that the board needed more time to review the note and the policy, and also to ensure that the direction is in the voice of the board and that includes guidance from the board to staff. And then there was feedback that was provided specifically on the strategic planning framework that included making sure that community engagement and that commitment to working with the community is explicit and prioritized, and that in areas related to strategic planning and working with key partners, that those key partners are explicit and that we have a geographic data lens related to our strategic planning efforts. Today, we have attempted to incorporate the feedback that we received before in the red line related to naming key partners, documenting the board's approval efforts, and this geographic equity lens and transparent reporting. This strategic system transformation strategic plan is intended to include our safety net focused joint community health needs assessment that is parallel work that we will be doing in collaboration with community care, and an updated healthcare services capacity and gap analysis that will also be part of that joint community health needs assessment that should be reflected in the document that's in front of you today, and also completing the Central Health Comprehensive Facilities Plan along with other strategic planning efforts as guided by the board. As we go through the next parts of the document, you might notice that the version of the presentation and the resolution is a little bit different from what was sent out to you in the backup. That is because we received feedback from a board manager that we further incorporated into these red lines. And so we'll spend the remainder of this presentation getting additional feedback from the committee. I know.
Rain?
Oh, yeah. I know, we have such strange air conditioning services at all of our buildings that it sounds like weather or gremlins, depending on where you are. So next slide, please. So I think this first part of the proposed resolution is fairly straightforward. It focuses on the Board of Managers adopting this resolution, which will guide the development and contents of the strategic plan. And it also documents that the board will review, amend, and adopt a new or updated strategic transformation plan, which will advance and complete the original health equity plan. A key piece on this page that we would just love to get your feedback on is that we are proposing to bring the completed plan to the board for approval by the end of calendar year 2026. And then also that the CEO is authorized to hire consultants as needed to complete this planning effort.
Very good.
Clarifying question? Okay, I just heard you say that the CEO is going to be able to hire whatever necessary consultants to facilitate the completion of this project. And I just wanted to make sure if that is going to happen before or after or in lieu of board direction, that it be approved.
Oh, no, I mean, when we adopt this directs the CEO to engage consultants. However, we still have to follow our normal contracting
The process.
process. Yes.
Okay.
So we would have the RFP
Okay,
as well
great.
as
Okay,
bringing
so
the
it will be
contract
through an
back for
RFP
approval.
process.
Yes.
Okay, thank you.
Thank you for asking.
Unless there are other questions, you can continue. Any other questions? If you would continue.
Thank you. Next slide, please. And this looks very similar to what was sent out in the backup, and it notes directly that the CEO will collaborate with the CEOs of Community Care and Sendero Health Plans on the joint planning, design, and implementation of the care continuum. One of the questions that had come up from a manager was whether this is a primary care driven strategic plan or an ambulatory driven strategic plan. And I think one of the things that we had discussed is that if we include an ambulatory driven strategic plan, that includes all of the care that our patients need in the community outside of the hospital setting, including specialty care, and it encompasses additional care in addition to primary care, but that is still urgent care, specialty care in community-based settings. And that we will also, if we go on to number B, this is really based on feedback we received from the managers last time, that we are adding that we will engage community organizations, neighborhood associations, and advocacy groups, as well as clinical and academic partners in the design and implementation of the system, ensuring that those most effective have a voice in shaping how care is delivered, and that the CEO will develop draft communication and community engagement strategies for review by the Strategic Planning Committee and approval by the Central Health Board.
Go ahead and proceed. Oh, you have a question, Jamar? Go ahead.
Thank you. So for A, would it be possible under, which line? 1, 2, 3. Under line 5, where you have who need whole person care that is patient-centered. I think we need to focus on that first before we proceed with ambulatory-driven trusted. So that is an addition, if possible, to be included, that our services need to be patient-centered.
Yes.
And also with B, to achieve this objective, the CEO shall actively engage and communicate relevant updates to patients and community organizations. Because I know engagement may differ, but I want us to be more intentional in our engagement. So those are my.
Read that language again for B.
Yes. So it's really minor. To achieve this objective, the CEO shall actively engage and communicate relevant updates to patients, community organizations, etc.
That's good.
And once you go to C, I have a small addition to that as well. So those are my comments.
Thank you. Very well taken. Any other comments? Cynthia, Manager Valadez?
In the development of this plan, I just wanted to make sure that somewhere in there, that the process of the plan itself is a most efficient plan. That we are talking about all kinds of things, and not one of them uses the word efficient. It could be like the development of the process, the plan itself, just so long that it is an efficient, or the most efficient. I don't know where you would want to put that, but somewhere in
Well
the,
taken.
if y'all can try and wordsmith that.
Sure, absolutely.
In there somewhere,
Yeah,
because
we will.
I did have a earlier conversation with Bedla about some of the efficiencies, or appeared to be efficiencies that have been incorporated in how things are done.
Well taken, and we'll add that. I'm sure Monica and staff will figure out the right placement and then come back with it.
Thank you.
Thank you. Any other comments before we move on to C? Okay, if we could, let's move on to C.
Okay. Next slide, please. And this slide had some edits that I think were shared with the members in the room before, or as we were starting, and it is that we were saying the CEO shall prioritize direct delivery of clinical services by central health system entities. We have removed the phrase "and partners" and added the phrase "while cultivating high-performing partnerships, avoiding duplication," and then we continue grounded in shared accountability, aligned incentives, performance on board-approved benchmarks, and clear board-approved governance structures that promote a seamless, high-quality patient experience across the continuum of care. Good? Okay. And then we note, continuing, that the benchmarks are grounded in the joint central health and community care community health needs assessment, will include the geographic equity lens that we had mentioned in the first slide that we received as board feedback, and that the board will approve the benchmarks, targets, baseline measures, and reporting cadence used to track progress on access, equity, and quality. And then to complete the review on this page, we're highlighting this, that the CEO shall engage key partners, including Integral Care, the University of Texas at Austin, the City of Austin, Travis County, and many healthcare and social service organizations in co-designing and implementing the system. And then we refer to previous board-adopted language that the CEO shall continue to develop in collaboration with Integral Care a system of care to provide behavioral and mental health services for central health patients, MAP and MAP Basic, inclusive of funding mechanisms.
Yes, ma'am.
So I have a minor addition. Under C, where you have in red, benchmarks will be grounded in the joint central health and community care, community health needs assessment. I want to also include evidence-based, because I want those benchmarks, even I don't know where.
Excellent, yeah.
So you find that appropriate? If, let's say, a benchmark is proposed, but it's not evidence-based, I propose that we bypass that, and if there's not any clear evidence, because it will be, in terms of efficiency, it will not be something that efficient or benefit our patient population. So thank you, that's my minor edit.
May we say benchmarks will be evidence-based and grounded in?
Yeah, that's what I thought. Yeah.
Manager May,
Oh, okay.
Chair May.
Yes.
The CHNA, the Community Health Needs Assessment, has that typically been jointly prepared by Central Health and Community Care. I was on the Community Care Board, and I remember seeing this, massive document, and I just don't recall, so.
This is our first joint community health needs assessment that we'll be undertaking jointly.
Okay, and that all is compliant with whatever role that, the FQHC has to do, okay. And the
Absolutely,
code-
yes,
okay.
and in drafting the scope of work, that scope of work is being drafted by Tara Trower and her team, collaborating with us to ensure that we're that we're including all of the requirements that need to be included.
Okay. Well, having seen one before, I would hope that the areas of exploration and everything would be something we see before it's deployed. Okay?
Absolutely, thank you.
Well noted, thank you. Chair
I'm
Kitchen?
sorry, I missed the last part, that it would be something,
To be deployed, that we will see before it gets deployed.
But there is a study.
okay, so maybe we can add some language, Monica, about the Community Health Needs Assessment report will be presented to the boards or something like that.
Yeah, it's just the
Yeah,
plan. I mean, it's a study. And then, of
Yeah.
course, you have study questions. And so
So
it
the
would be
study
nice to see the study
scope.
questions beforehand.
so the study scope will be presented to the boards.
That works for
Does
me.
that work?
Well, that's what's gonna be leading
Yeah.
the data that's gonna be collected and presented for.
Any further questions on bullet C? Okay. Can we continue?
Okay, next slide, please. So this slide really focuses on, or this section of the resolution focuses on, and this may be a good place as we come back to it, Manager Valadez, adding the part about efficiency, but it focuses on leveraging our statutory powers and financial capacity, emphasizing infrastructure ownership, prudent management of reserves, and transparent reporting. So I think we'll bring back before next time an addition related to efficiency in this area. That this is where we talk about the use of resources. And then the addition from last time in the version is that the board must approve capital and financing decisions, which will be presented as distinct board agenda items with options, trade-offs, and alignment to the strategic plan. And then in number F, we talk about will include a joint safety net focused community health needs assessment with community care and Sendero, and a new service delivery capacity and gap analysis. I think Manager Jefferson, we can add language here about bringing the scope of the community health needs assessment to the boards. And then also the updated CHNA will confirm and extend the findings of the 2022 CHNA through an updated 26 CHNA while addressing needs related to closing identified deficiencies across all domains of care. And that community engagement will be a key component of these assessments.
Manager Valadez, you have a comment?
Only because I didn't know exactly where it should go unless we're talking about the end result, and when we get the outcome or the actual plan, that there would be, and the development of priorities, that there would end up being, that it would be our priority to address the greatest needs first. I didn't know if we were going to be looking at that, because we'll have the community needs assessment. We will have a plan being developed in order to address those and close those gaps, those disparities gaps. But it needs to, I would think that the greatest gaps should be addressed, that impact the most people should be addressed first. I don't know if that makes sense at this point, or if that's just understood as, yes, of course that's going to happen, but in my opinion, in my history of working with plans, that doesn't always happen. Because there may be a tendency, well, we're going to deal with the low-hanging fruit first, as opposed to the greatest need first and the most impactful on our poverty population. And I'd like to make sure that somewhere or another we capture
Would you
that.
address that, please, Monica? Where-
Well, I wonder if there is,
Because I don't remember seeing that.
right, saying that there is going to be a policy to address the, like, largest gap first instead of low-hanging fruit. And I do think that's something, if you look at, and it doesn't directly address this, if you look at item G,
Yes.
when we talk about the strategic plan proposed
Analysis.
service to, and this was an addition that we received feedback from one of the managers, that the proposed service delivery locations and identified capacity and gap analysis will be based on demographic analysis, which identifies current and future locations and health needs of the population Central Health serves, and that will consider analysis of city, county, and other relevant government bodies in completing this analysis. I wonder if that would be an appropriate place to add in something about prioritization of gaps?
I got, if I may I hear from the chairman first?
Just a really quick, I think, Cynthia, there is a thread with all of us that we care about the poor and the vulnerable and providing quality care. I think the strategic plan is one area to add it in there. I think there's also process when you do a community health needs assessment. There's so many issues that come
That's
to
right.
go, and then you discern what the priorities are and what you're gonna focus on for the year, and that's another engagement with the board about what the priorities are there. And then there's an alignment to the strategic plan, to our budget and finance as well. So I think there's other opportunities to ensure that's the case, and I'm really glad you highlighted that. But I just wanted you to know, this is not the only place
No,
where.
I understand. I just
where-
wanted to make sure that since this is a multi-level plan that's being developed, you know, you have the city, the county, you have all these other entities. Our focus is on the health and access to health for our poverty population, and I want that to make
Yeah.
sure that that is clearly understood as our priority.
And I wanted to ask a question around that, Chair. Is from your perspective, from the administration's perspective, is this the strategy? Like, I would hope there's one strategy and everything else fits underneath it. So the health equity plan and everything rolls up to this. No matter what strategic plan, this is the one strategy plan that covers all of them, and this is the process by which
Yeah.
it'll continue to roll out. I just wanted to make sure that that's how you all saw it as well.
Yes, that's the
That would
intention.
be the case. I've got Maram first, and then Dr. Martin.
actually
Oh, did he ask?
what I wanted.
He did, okay, then I had Dr. Martin had his hand up.
Sure.
Yeah, I think, Manager Valdez, I think that, in my impression, this is sort of that care issue's implied. One thing that's important to realize is, what is our capacity to deal with that deficiency? We may have a way backlog, enormous discrepancy in neurology care. We don't have a neurologist. And so I think it's important to identify, but also understand that we have certain capacity limits that have to be considered as well in terms of delivering the care.
Manager, it's just that we've been in existence for 20 years. And in 20 years, we have all known that the reason we were created was to improve not only the quality of care, but the access of care for our most needy. And so when we say our most needy and our most vulnerable populations, if we waited 20 years to identify what the most needy and the most vulnerable disparities, gaps are that need to be addressed, well, it's about time we're doing it. And I just want to make sure that we don't forget that we
Well,
are going to continue to do
if
that.
I may say something, I think we're discussing different needs. I think you're discussing financial needs, I'm discussing the medical gaps.
No, I'm not talking about financial needs. I'm talking about the healthcare needs and the fact that we, or the entity that's providing the finances or resources to be able to close those gaps.
Okay, I've got a comment from Chair Kitchen.
I have suggested language to add. And this would probably be the good paragraph to add it in. Just something to the effect, the board will consider the greatest need for most people in setting priorities. Or you could say the board will consider the greatest need for the most needy and most vulnerable populations in setting priorities. So it's not saying what the priorities, it says that that's going to be considered in setting priorities.
Thank you.
So you could wordsmith that, Monica, but that's what I'm,
Yes,
okay.
okay. If we're good, we'll move on. Unless, I'm sorry, I just noticed that you just joined as manager, Matawi, so go ahead.
Thank you, Chair May. I, first of all, certainly agree with Manager Valdez, and any of us who want to make sure that the most profound and greatest needs in our community, particularly our vulnerable, our income vulnerable community, and therefore health vulnerable community, are met. And I also just want to underscore what I feel like is the complexity of starting to measure that. It's like measuring morbidity versus mortality kind of thing. Like sometimes, for example, and so I think we could probably learn from, there's probably discussion to be had around this, perhaps in a retreat, just like a framework, you know, what are the guidance or frameworks that physicians use really in triaging care, right? Like, for example, if there's a need that's affecting our poverty population, 80% of our poverty population, say, doesn't have access to dental care, but then there's another need that 17 people do not have access to maybe another kind of care, and there's a risk that 4 of them may lose their lives, then how do we start to make the moral decisions and the appropriate decisions, the prioritization decisions, in such a way that we codify them into plans? And it's definitely not cut and dry, but I think you've brought up a theme that would be worthy of exploration, I think more profoundly than just sheer quantity or magnitude. So, thanks.
Thank you. If we can go ahead and move forward. We're going to try to adjourn, hopefully by 4:30, so if we
I
could.
think the last, we've noted that, so we've discussed G. On H, the board will approve the Central Health Comprehensive Facilities Plan. And then I is an addition around the other additional strategic plans that were adopted in the table of governance decisions. And I think one of the questions is that had come up in the past 30 minutes is if this section on I, capturing these additional strategic plans, is part of this system transformation strategic planning resolution, and the thought around including that in this resolution.
2 comments I have. I see Manager Kitchen's hand up first, and then I'll take Manager Musaitif.
Yes, I think it should be referenced here. I think we talked about earlier, the chair's question, that these all roll up into the strategic plan. So this is just acknowledging that the board's role in approving those additional plans, including those identified in the board-adopted table of board governance, for the purpose of aligning these plans with the strategic plan. In other words, your sub-plans, you don't want to adopt a overall strategic plan and then have your sub-plans not align with them. So that's why it's appropriate to include it here.
Thank you. Musaitif,
Yeah,
Dr.
I have
Musaitif.
2 comments, and I wonder, like, for instance, I know we talked about this in the past, cancer care. Would that be overarching of the services of expansion, or do we want, or would this be built into this plan? Because that's a critical need, and we've had, we know the data and what was presented to us from the health equity plan as well. So do you have a short comment, like, is it part of this, or?
The short answer is yes, Dr. Musaitif. And the slightly longer answer is just as you referred to, we saw that clear signal in the demographic study this past year. It will likely be part of the scope of what we look at in the CHNA. And then we have dedicated work. We're trying to get a better understanding of the gap in cancer, validate those findings, and maybe take a regional view as well. So we'll be taking all of these data inputs into consideration as we do our best to articulate, as I said earlier, what is the overarching direction in order to create that comprehensive continuous services that the data reveals that our patients need. And cancer is really part of that.
Thank
Okay,
you.
Thank you. And my last comment, so I don't know if this would be appropriate as be it resolved. So I have to this resolution. So what I have proposed in language, the plan shall be financially and operationally balanced, ensuring that the available fiscal resources and physical infrastructure are aligned to sustain current services without compromising quality, access, or long-term stability, and is aligned with Central Health's mission. So I was wondering if that's appropriate to add, that kind of capitalizes
Very
and
good.
conceptualizes everything what we have
Yes.
discussed and the
Oh,
efficiencies.
yeah. I think that's a great suggestion, unless our, very good.
Okay.
Monica, if we could include that, I'm sure she can get that to you, unless you want to have a comment about that.
I would say if there's a way, if we could go back one slide to number E, if we could incorporate some of the language that if we could incorporate language you provided into this number E along with Manager Valadez's efficiency language, if you look at number E as drafted, it mentions that the system shall be designed for long-term sustainability, maximizing available federal, state, local funding to minimize the financial burden on taxpayers while ensuring that every public dollar delivers lasting community value. May we take the language that you've got and work it into this section as well?
So I would perhaps prefer it to be its own subheading. I know it says it's probably a little redundant of some of the language you have, but this is actually like summarizing the overall plan that just really, yeah.
Say
I
final
think-
resolve.
Yeah, it just by resolved. It doesn't really interfere, and I think it actually emphasizes that bulletin E, but this is by resolved overall, this plan. So I don't see why, I think we touched on it, so it's nothing new.
Yeah. I think we can live with it, right?
Absolutely, yeah, I think that makes a lot of sense.
Outstanding. I've got,
Okay,
the
go ahead.
chairman still has questions that I haven't given a chance to say. Yes.
Well,
Mr.
first of all,
Rodriguez.
I really appreciate you all taking all the feedback, because when it comes to the board, you're discerning whether, like, for example, Manager Musdif's comments, whether it's in preamble or in the be it resolved section, and then you all can work with her during the time period between. I think the one, I had just one quick, I guess the lawyer in me, and on I, the second sentence that says these additional plans include, I wonder if you should add, but not limited to these particular plans, because I think the one
Yes.
thing about this is that it reminds me of a governance issue, because there is a little bit of a tension here between not wanting the administration, not holding back the administration to operationalize the things that we're agreeing to do, but also holding back the authority or oversight from the board around issues like, well, if you're creating a strategic plan, what's the budget implications? What's the facilities implications to that? What's the policy implications? Because potentially some of these might need additional policies that we don't have in place. And so I think that's why this would be appropriate, but with that understanding that there's really a tension here, but recognizing that we're trying to do the oversight, not the operations pieces. So I hope that's helpful around but that's
I think
really
it's
good.
helpful,
language,
yes.
yeah.
I do agree. Exactly, precisely. Thank you very much, Chairman. I believe Manager Kitchen had
Oh,
one
no,
more
I'm sorry.
comment. Did you have one more comment? No, okay, very good. All right, I do believe you've gone through all the aspects of the presentation, hopefully. I'm sure you and staff have captured all the excellent points, and we'll probably be seeing another iteration of this. That being said, do you have any final comments before I move it into, I'm gonna be seeking a motion, so any further comments?
No further comments. I will need to get more language from Manager Kitchen and Manager Musaitif. So thank you.
I can email it to you as well.
Very good.
Thank you.
All right. All right. With that being said, I am looking for a motion to move this resolution with its comments forward.
May I
Is-
make that motion?
Yes, of course.
I move that the committee recommend to the full board adoption of this resolution as amended by our discussion.
Do we have a second? Second. We have a motion to to adopt this resolution as it has been amended, and we have
Recommend that it be recommend to the board that it be adopted.
and recommend to the board that it be adopted, and I have a second by Manager Valadez. All those in favor, please signify by saying aye. Aye. From
Only
the
your
committee,
committee
from the
members.
committee. Yeah, that's right, from the committee. Did I get an aye from Ms. Jefferson, Valadez? I got one from you, and of course myself. All right. The motion passes, and we will move it forward to the full Board of Directors. Okay, thank you very much. I appreciate your time and your work on this. All right, so I think that pretty much gets it. I will now confirm the meeting of the next strategic planning meeting, and that will be happening Wednesday, February the 11th at 3:30. So by then, we should have a new agenda where we'll be determining our work as we move forward. All right, with all that being said, may I have a motion to adjourn this meeting? Second? It's been moved in second, I second it. Second? It's been moved in second that we adjourn this meeting, and this meeting is now adjourned. I'll pass the baton over to Manager Matwani for his infrastructure meeting.
That is a baton.
That's heavy-handed right there.
Okay, just need a quick moment to calibrate my brain and paperwork, if you bear with me. Okay. So let's go ahead and get started. Everybody good? Are we missing? Oh, we're here, yeah. Okay, yeah, but she wasn't here previously, right? Good afternoon. Today is January 14th, 2026. The time's 4:35 p.m. Quorum of the committee is in attendance. I'd like to call to order the meeting of the Central Health Infrastructure Committee. As a reminder, a committee member may also be participating by video conference, though I'm not aware that anyone is. So the staff nonetheless will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting. I'd like to announce, in order to make it more accessible to community members, we previously held public communication for the Strategic Planning Committee, Infrastructure Committee, and Executive Committee meetings earlier. So unless a member of the public wants to comment on a specific agenda item now, we will move forward to the committee agenda. Looks like we're good in that sense. And so we'll move to agenda item number 1, which is to review and approve the minutes of the November 17, 2025 Infrastructure Committee meeting. And I do want to make sure that everybody has a corrected,
Just as a reminder, sorry, because this came up in the last meeting, the 3 members of this committee are Manager Chair Motwani, obviously, Manager Martin, and Manager Musaitif for the time being.
Are you done, David? Before I was so kindly interrupted, wanted to chat about the minutes and make sure everybody had an updated, corrected version in front of them, or at least the 3 committee members, but certainly the entire body here had an updated, corrected version, and wanted to thank Past Chair Kitchen for catching an oversight that are now incorporated into the minutes. Chair Kitchen?
Yes, I think there's one other item of substance that wasn't captured here in this corrected version.
Mm-hmm.
When you made your motion related to the Brackenridge plan, you used language about directing staff to reopen engagement on the Brackenridge properties in considering certain principles. And the principles aren't mentioned here, but I remember them having to do with relating to community sentiment and something to that effect. So it's not, I don't remember exact words that you said, but you did point to, there was discussion and you did point to engagement aligned with the principle of community. Is that making sense to you?
It does make sense. I mean, what I'm remembering is that we were talking about guiding principles that might frame a paradigm through which we would re-engage or
Yeah.
open that engagement, and inertially, surely included the discussion of those principles there. I don't remember exactly what they were, but I mean, if we could potentially move past this agenda item and come back to it, we may be able to review the transcript in the meantime to clarify that.
It's on the tape. I listened to the tape, but I didn't write down the exact words.
Yeah, I mean, if, I don't know if anyone could, get a transcript of the tape or whatever and take a look at it while we're doing this, just to get the exact language. Happy to move that agenda item to later. Do we have staff or, okay. You have the exact language? Or you-
I listened to it
Uh-huh.
and I tried to get as close to word for word.
Okay. So, while we're noting that, just also want to note that in these minutes, in the corrected minutes, number 3 and number 4 are a repeat of one another, so perhaps that might be what happened. That one, the clause with guiding principles was maybe copy pasted out. So we'll replace one of these duplicate ones with the new text. Will you be able to, do you have that available now, it sounds like, Perla?
I do, I'm gonna print a copy for you.
It's not that critical that you adopt the minutes. We could just put this on the next meeting. Do the
Yeah, minutes are for
corrections
the
and then
birds.
Bring it back to the next meeting. Yeah, it saves some time.
Well, I mean, yeah, if we could knock it out today, it'd be great. I mean, not trying to knock it out in the second though, so, just for whatever, compulsions I might have to wanting to make sure, it's all done. Yeah. But that being said, thank you, Perla. Thank you, Perla. So we'll move to the next agenda item, which is, to receive and discuss an update on the facilities master plan. And for that, we will have Monica Crowley and Stephanie McDonald presenting.
Chair Motwani, if I may, I was just going to briefly get us started with a bottom line up front. Great. So thank you, Chair Motwani, for teeing this up, and thank you to Monica and Stephanie and teams for the thoughtful and complex work that went into developing this draft table of contents. This table of contents is intended to serve as the foundation of our comprehensive facilities plan. No, we're actually inviting a shift from the term master to the term comprehensive facilities plan. Same intent, but perhaps just a better choice of words here. And then this is intended to inform the scope of work for both our internal teams and external consultants as we move toward implementation. Today, our goal is to give you a clear sense of what we put together so far and what we're considering for inclusion in the plan. This is an early draft, and we're very much looking forward to this committee for input and feedback. We'll also walk through a proposed phasing approach to implement this work, including the reasons why we're proposing the phasing, so you can see what's upcoming and where your guidance will be most critical. For instance, as you'll see shortly, the work is organized or proposed to be organized across 2 tracks. Track 1, which is focused on comprehensive planning for 2 major areas, our downtown campus and our Northview campus. And then track 2, which broadens out to cover our comprehensive facilities plan more broadly. And we welcome your input on both tracks to ensure we're aligned and head in the right direction together. At a high level, the ultimate goal is for this comprehensive facilities plan, in concert with the strategic plan we just touched on and our community health needs assessment, to all be fully aligned and speak to one another in a coordinated fashion. And this is just a beginning. Over the next year, we will return to this committee regularly to help us discuss and work through major decisions, including approval of a plan for the downtown campus, budgetary considerations tied to service delivery, siting decisions related to diversion planning, and so on. So for today, we're primarily looking for the kind of sense of the board and the validation of feedback on this general direction, the scope, sequencing, and approach. We appreciate the opportunity. So with that, I'll turn over to Monica and Stephanie to dive into the details. Thank you.
Thank you so much, Pat and Chair Motwani. And as described before and just discussed in the minutes discussion in November and December, the board and committees began discussions regarding comprehensive facilities master planning based upon the feedback that we received from the board. We have worked as staff with Chair Motwani to develop potential phasing options for this work, as Pat mentioned, and also a provisional table of contents for a comprehensive facilities master plan that Chair Motwani shared with the board in a memo form last month. As has been discussed, this comprehensive facilities master plan will guide the boards and staff at Central Health Community Care and Sendero as we work together to address gaps in quality and access to public facilities, move forward toward ownership models for our work sites, and make decisions related to aging infrastructure. And as Pat said today, we're presenting a proposed phased multi-track comprehensive facilities planning approach with potential timelines for undertaking the work. And then last but certainly not least, we would like to gather feedback, additional feedback from you by walking through the major elements of the provisional table of contents that was shared by Manager Motwani last month, so that we can gather additional guidance from the board as we move forward. So if we look at this first slide.
If I could pause you real quick,
yes,
Monica, I
please,
just wanted to
Manager
take a second to thank staff for the heavy engagement on this, particularly in over December and the new year. It's holiday time, and I know, and I could tell just in our discussions in our prep meetings how profoundly staff had been working and reviewing clearly other examples and working with other expert resources. And though the conversation was substantially advanced, I think at the outset, I've definitely felt a level up, which I feel like I've been required to match, and I'm glad that we'll all be able to do so, and look forward to it. So just wanted to make sure I had a chance to thank y'all before I forgot, and please carry on.
Thanks, Chair Motwani. Now I'm all embarrassed, so thanks. As mentioned previously, based upon the initial board guidance from November regarding re-engaging in efforts to plan for the downtown or previously known as Brackenridge Campus. And based upon the need for a smooth, phased development of the recently acquired Northview campus, we are suggesting taking a dual track approach to facilities planning. And this will allow us to conduct facilities planning work in parallel as we begin. So facilities planning work around the Northview campus, which we've got significant health needs that campus was purchased to address. And there are tenants in that building, so there will need to be a specific planning effort around the development of services for that complex, as well as you were just discussing, a need to re-engage on the downtown campus efforts. And that is why our track one proposed plan is related to the downtown campus and to this Northview campus. Some highlights of this planning work include assessments of the age, size, location, and functionality of current infrastructure in both of the areas in the downtown area and of the Northview campus as that is developed. Also, in looking at particularly at the downtown campus, we're taking a healthcare service delivery focused, comprehensive planning approach for future facilities and programming. And based upon the information that we had from listening to the prior meeting, that would be based upon a community engagement, based upon the demographic and geographic characteristics of the people that Central Health serves, and based upon the health needs of the people that Central Health serves. Also based upon an updated medical services capacity and gap analysis, and based upon an assessment of the future of healthcare and where healthcare is heading as a practice. Specific to the downtown campus site, there are community efforts in diversion services, planning, and mental and behavioral health programming that Central Health has been working on with Travis County Integral Care and the University of Texas. And that is one of the reasons also that we are moving this downtown campus piece into a priority timeline. And then also at Northview, we need to be able to design how this hub can serve as a women and children's center of excellence, including services for people in and exiting foster care.
Monica, can I just add that we did learn from both our partners at Harris Health and University Health System that they have taken an approach where they have created specific master plans for specific campuses and properties while they are working on a larger strategic framework.
And then also just related to the prior item that Stephanie did, we wanted to remind you, and this is something we also can send to the entire board now, but I think when you guys constituted the infrastructure committee, yes, if you'd like to go through some of the documents that have been shared and can be shared.
And we, of course, I will send them to you as well and make sure that you are up to speed. The infrastructure committee did receive the overall document for the downtown campus master plan that was done several years ago on February 14th of 2024. Happy to send that out again, and we did send the guiding principles out at the November meeting, and I just want to make sure that you knew that that's maybe where some of that language came from. And I think there was a specific question. We can answer it now, and if there are any questions, we can talk about that perhaps in the second item in closed session around actions that the board took specific to the downtown campus. So in October 25th, 2017, the Central Health Board of Managers voted to direct staff to negotiate with Wexford for the development of the downtown campus. In January of 2018, Wexford withdrew from further negotiations with Central Health. On February 21st, 2018, the Budget and Finance Committee directed negotiations with the 2033 Higher Education Fund And on October 10th, 2018, the Central Health Board of Managers approved the ground lease agreement with the 2033 Higher Education Fund. And all of that is in public.
What was that last one? I didn't quite hear it, I'm sorry.
On October 10th of 2018, the Central Health Board of Managers approved the ground lease.
That's for that one building that's there.
Well,
Two.
two buildings, one building, another block. adjacent.
I have a comment. Do we, I don't know if this is something that you have done or you're planning on doing, an evaluation and estimate of how the property,
Oh,
We had that.
that's
it has,
interesting.
it changed.
Sure. We have, I think we might need to talk about that under the second item if we can.
Okay, thank you.
Sure. I have a suggestion to add under the second bullet, plans may include. Is this the time to do that?
Please, are we done with the slide?
Yes, and I just, the only other item on this is for this planning, because there is more time pressure because of the other community efforts and because of the need to start development on the Northview campus. We would propose working with consultants that are in our existing consulting pool on these efforts. Of course, we would follow our requirements of the procurement process, and the board would approve contracts that are entered into under and we'd bring back the scope of work.
And so to
for
reiterate that we
agreement.
talked about that,
But, yes.
and I just want to point out what that means. You all will hear more about the second track and how much of a more of a comprehensive solicitation process that's going to be. In this case, there's a need for expedience because there are interdependencies between the development of this plan and then the development of the larger plan. And so we want to be able to optimize on time. And then secondly, we've already got a lot of inertial subject matter expertise from previous engagement. And so with the latent expertise in consultancy that we have in the existing pool, coupled with the need for expedience, further coupled with the fact that it would adhere to our procurement policies, this is what is proposed. So we'll pause there. We can have a grander discussion about that after we've heard about track 2, but I just want to clarify that.
I do have a question. So what kind of skills do these, what do these consultants do? Do they study space planning, or are they talking about medical facility? What do they do?
Yeah, so there are, we would likely engage and have in the past for these comprehensive planning efforts have engaged teams of consultants. So you have consultants that are involved in healthcare service delivery, planning, and the healthcare phasing and staging and sizing and scoping of the services that are available, the financial piece, the sustainable funding piece, as well as architects and designers who work in the healthcare planning arena. Stephanie?
There is a design component, but obviously what we really need to figure out first is what problem are we solving for? What services are we trying to fit in the gap analysis? We did do some of that work for Northview, and we'd be happy to share that with you. But there's also, in the terms of adjacencies, what it makes sense to be together, and then we can start thinking about what size on the campus or in the building, in the facility, do we need to allocate? And really, truly, in the phasing, say for Northview, we want to make sure that we don't put something in one quadrant that then we want to grow and then we run out of space for example, right? So we want to just make sure that we've got the right brains, including understanding the design and the efficiencies that we might want, the adjacencies with other services, and then also really analyzing the gaps that we have in our system that we're trying to solve for.
And this will be aligned, not just parallel and aligned work, but hopefully braided
work that is braided together, and
CHNA
nesting up
and-
into the community health needs assessment. So you look at the demographics, the geography, the, health needs that need to be addressed, as well as, market conditions and things that need to be adjacent for things like the downtown campus. Are there types of services that are, advised to be located near a tertiary facility or adjacent to a level 1 trauma center? What are gaps that are available for the safety net, particularly in the community, that need to be filled and that could be best filled in a centralized geographic location, as well as just what type of green plating can you do? What type of design elements are there? What are the kind of architectural and facilities-based requirements of the piece of land that's available, and what may be developed in that area?
Go ahead, okay. Under the plans may include, I wanted to suggest, you've got a second bullet that relates to programming of services and facilities. I wanted to suggest that include the respite care, continuum of care needs, such as housing needs, permanent supportive housing. Not suggesting we have to put that on this location, but I think we should consider it, particularly since what we have discussed and what has been really so innovative and precedent-setting about our respite care program is the intent that it be a program that carries the person all the way through to permanent housing, instead of respite care and then dropping off back into homelessness. And our respite care facility currently is right there. So, I would hope that we would include in our assessment some consideration of what might be possible. Okay? That makes sense. And I want to commend Dr. Lee. He has continuously talked about the importance of respite care, continuum of care. So, and what's different about that is all the way through their needs. So, okay. Thank you.
I have it's a question kind of for you, for everyone really, sort of, what is our relationship, since we're really healthcare providers, to say, the housing authority to allow for that to occur? Because we step off at some point with healthcare and to segue to bring those communities together.
I think
to
that-
actually have that happen.
May I? I think that's a very good question. And I think the thing that I'm thinking of is not that point, because I'm thinking more of the point where, like, permanent supportive housing, which is not someone who can just go off into housing without needing those healthcare services.
Right.
So, but the relationship, I guess that's what you're asking about.
Yeah, but-
No, we should be developing whatever relationships we can.
And that's kind of my point, I think, because at some point, we continue the healthcare aspect of it. At some point, we kind of want to hand off more the housing aspect. And I think the establishment of those relationships, if we're really going to carry that forward, I think is what we really should do as an organization. I think the creation of those is really, really important to those foundational agreements to some extent.
Yeah, I would agree, but I would also think that it needs a much longer conversation about the ability to hand off, because what is happening in our community right now is there's nobody to hand off to.
Right, and that's what I'm saying.
So-
I mean,
That's right.
to nurture that relationship, I think to build that up. I just was curious as to that, if that second part of the puzzle is kind of being worked on, because we're doing the healthcare
Yeah.
respite care, but
Yeah. I would love to have maybe in the strategic planning committee somewhere, I'd like to have a much longer conversation with an update on how our respite care program is working. And to include the point that you just asked about, which is how are our relationships working in the community, and what is even possible, given all the needs that are out there. So,
You got that,
Yeah,
Chairman?
got it.
Okay.
Real quick question. I just wanted to make sure for my own kind of clarity, because when you say plans may include, when you're talking downtown campus and Northview, from a comprehensive facilities perspective, you're describing the entire footprint of that particular campus, which would include the clinical education center and the parking garage as well,
would.
right? I just wanted to make
Yeah.
sure it wasn't limited to just these things, but it was the, it was
14.7
the
acres.
physical footprint of the facility is what we're,
Okay.
we're talking about.
All 14.7 acres.
And these are some highlights of planning around these areas. And I think as we look at the prior planning, that master planning or comprehensive planning that was done around the Brackenridge campus, just because something might be an appropriate site for a service like supportive housing or an urgent care center or, other services, that doesn't mean necessarily that Central Health would be a sole builder or provider of everything on a potential campus. Typically, as part of these plans, in addition to developing things like guiding principles, as you're kicking off the plan, as you develop appropriate uses, you work with, they'll recommend potential partners
Right.
that you could work with, Dr. Martin, like permanent supportive housing providers, people that would build things on your particular property that are aligned with the Central Health, that are aligned, of course, always with our mission and the needs of our population primarily.
Which goes to the suggestions that we have made historically over the past many, many years and have talked about as of late, the last couple of years, the development and incorporation of the serving as the overall convener of all the various entities, taxing jurisdictions and appropriate partners in the development of those overall future plans to accommodate the gaps and research that is going to be gathered and presented to us through the I guess like the CHA and the CHIP and whatever. And also up there, it's not only the update the assessment of current facilities and the plans, which may include current and future facilities for Travis County, which we were not only talking about Travis County at one point. I thought we were looking at maybe the possible regional needs that all align or point to, or that we have to address as an entity that is looking to close disparities gaps. So I think I've heard Dr. Lee, I've heard Ann, I've heard several of our board members talk about that committee or convener over all the entities. I don't know where we're at with that, but I sure would like to know when we're actually going to start that, or whether we're going to add ourselves to what the city had already been doing. So, thank you.
And particularly as related to the regional needs beyond Travis County, I think we could maybe visit that when we talk about the table of contents and whether or not that should be an element included, and as a board discuss whether or not that should be folded in. So.
Considerations of what the CATCOG is doing for the regional, because that's 21 counties.
So that would inform, yeah, okay.
That's right.
Unless we have further comment, I'd love to move through.
Thank you. So the parallel track 2 around comprehensive facilities planning is the more holistic, longer-term, overarching comprehensive facilities plan for the system that would primarily focus on looking, of course, in addition to looking at the review of what the current facilities are, and we'll go into more detail on the elements of this as we review the table of contents. But some of the highlighted focus areas would be looking at ambulatory care needs for the entire system and the facilities that are already in place and facilities that need to be put into place into So this is an analysis of the ambulatory needs across the system, including reviewing current facilities and patient needs. Also, as we continue to look at, and as past Chair Kitchen noted, looking at the respite care continuum, we would look at the entire post-acute care continuum and needs for our patient population, including how a skilled nursing facility would fit into the system needs and where that might be best located. And also continuing to look into imaging needs and needs for ambulatory surgical centers, which are areas of need for our population and are important to the entire system. We would intend to issue an RFP for consultants to support this work. And we would propose using information from the table of contents to develop a scope of work for that solicitation. And so this would build on both the healthcare equity plan, also parallel and in process system transformation, strategic planning efforts, and the joint community health needs assessment that also will be in process during this time period.
Just a quick comment. I'd like to make sure that we're also taking into consideration the community gaps in education and literacy and care for their own family members that they may not necessarily get when they're discharged or are going to be having to take their family member into the various facilities that we're creating. Doesn't necessarily, I'm just wondering whether or not this would be an opportunity for us to look at incorporating into our different educational entities throughout this central Texas area, so that they can help us by growing health literacy amongst the student population, especially since it's students who are going to be growing into taking care of elder and sicker family members that may or may not speak the English language or even have the capacity to take care of them or care for them. So this just goes into another little thread.
It seems like possibly in the table of contents, we may want to discuss later
For
the
resources
notion
and
of
training,
either
education.
co-location or proximal location with institutional potential community partners.
That's right.
Who are part of a broader continuum of
That's
well-being,
right.
not necessarily.
So we're growing our community base and foundation, educational foundation.
Okay.
Thank you. And that's also good feedback around the community health needs assessment and potential, scope of work there. Thank you. Next slide, please. So this next slide, it lays out a draft staging for plan development, and this is an aggressive timeline. So we just wanted to, I know.
Gee, Monica, thanks.
Yeah. So we just wanted to lay out this proposed timeline for the different tracks. Is looking at the first track. This is going to assume that our work starts almost immediately on the first track, and that there won't be any unanticipated delays. This first track includes identifying the existing consulting expertise. In December and January, we would hope to enter into agreements and scope of work in February to move this forward, and then initiate the project and plan development in February, and do this probably February through August. And looking at this timeline right now, I think it's even more aggressive, that it's more aggressive than accurate. And so we shift track one, so apologies for that, but we would shift track one month over, even from today. And then looking at track two on the comprehensive facilities planning work, we would develop the scope of work based upon the feedback that we received based on this provisional table of contents today go out to the street with the request for the proposals in February and March, finalize contracts in April and May, and start the plan development in late spring, early summer, and hope to have something to bring back to the board within the next 12 months on the comprehensive piece.
Just one comment.
Can I make one really quick?
Yes.
I just want to point out to everyone, look at the bottom lines of the Gantt, of each of those timelines, and just see where that first one stops and where it hands off to the second one. So that first one stops, basically at the beginning of month 3 of the second one. Those are the lines that are the most important for me anyway. Of course, the planning, staging, and scaffolding before it all is important. But understanding that handshake and the importance of the codependencies, or the interdependencies, I should say, between these two planning efforts. And also, therefore, the need for not just expedience, God bless the staff, but also resoluteness on our part. We've asked for feedback on the table of contents. We're about to do that again. I think it's been sitting with us all for about a month. And so it seems like we've already got a few good points for ripe discussion in as much as what might also be added as content areas. So please keep that in mind, because, I think ideally, once a plan is developed, it would be revisited at some cadence to be refreshed. But, hopefully we can get to a point where we are resolved around the content areas that we want to move forward on now for this first iteration. So with that said.
And mine is just a brief comment with respect to our contractors, or our pool of existing contractors, which is what I think you said you were going to be looking at for expediency's sake. I'd like to personally know whether or not we stay on top of contractors who have not been timely with the completion of set goals. Anybody that we've had to pay, we've had problems with in the past, that they're excluded from this pool. Anybody that we've had to continue to pay, whether they had completed their jobs or set goals for that time period, have they been timely or not? Have they been accomplished or not? That's all. And I'm sure Central Health has an evaluation or analysis for the contracts completed by contractors. I'd just like to know. I know I've never seen anything like that, but you all have. So please, let's not enter into contract with somebody who's been a disappointment for us.
Got it.
Thank you. Next slide, please. So we are going to, and as Chair Montwani mentioned, hopefully many of you have had a chance to review the provisional table of contents that was shared at the December 17th meeting. And we already received some feedback on that table of contents, but we're gonna do like we did during the prior meeting and gather feedback in. I think the table of contents is contained in 2.5 slides. So we've got the next 2.5 slides to gather feedback on the table of contents. And some of the feedback that we got, if we look, there would be an executive summary that would provide an overall context for how the plan aligns with our mission, along with key findings and recommendations. Next would be an area on purpose, scope, and the planning horizon to describe the context for the use of the plan across the central health system over time. I think this may be a place where we could incorporate comments suggesting to align with the system transformation plan and also align with the future of healthcare. If we could add those bullets here. Then also we would look at the planning process and methodology, detailing the structures for developing, reviewing, and approving the plans and the inputs that will inform the plan. Looking at the current state assessment section, we have anticipated that this will provide a detailed summary of all of the clinical administrative spaces and properties within the Central Health system, including those that are leased or owned. This is one area that we proposed that in the table of contents, but we did want your additional feedback on that in particular.
When we say building assessment, there are some facilities, and I'm gonna look at Manager Jefferson. She might know about the South Austin facility, for example, that Community Care is operating in. It is a facility that is owned by the city of Austin. It is an aged facility. It is, I can say this in open session, it is beyond its useful life. But I think there's very little efficacy in us doing a full building assessment with an outside, vendor consultant on that facility. We know, for example, that building, as in its current form, is, not where we want our patients to be getting care. So I think I would recommend that we would provide a list of the facilities that we would do a full assessment on, and obviously we've done some recently on the 2 new acquisitions, and then we can, prioritize the large hub sites like Southeast Health and Wellness Center and North Central, which we are already underway doing facility assessments on, and then maybe not prioritizing some of the other lease sites, especially working with Community Care, making sure we know kind of where they would like to be. Some of those lease sites, it's harder for us to control any improvements on those sites as well. So I think really looking at the community health needs assessment afterwards and trying to prioritize the areas that we know might need to look at future growth, and not necessarily spending resources on assessing smaller leased facilities and facilities where we already know, for example, it's either beyond its useful life or not in an area where we think is best serving our system.
Thank you for mentioning that. And that kind of gets to a question that I have. So the timeline that's been presented for track 1 and track 2 makes me wonder whether that timeline alters the time frame for other development that's going on. You mentioned the needs for the South Austin Clinic, the timeline for Colony Park opening. What is this gonna? Is this going to cause those other timelines to be shifted, adjusted?
I don't think so.
Okay.
But I'm cautiously optimistic, and not because I do have a fantastic team, and as does Monica, and we do have great contractors that we work with. I'm getting my own mic. But also, I think these are different skill sets. And so we will work to, I do want everyone, especially Ms. Scott and the community, to know that we are working very hard. Manager Jones is listening, I'm sure, right? Colony Park, we hope to break ground on in February, but that means it's in the construction phase. It's a very different group of skills that we need. And so the people working on that project, they will influence some of this. We have a very separate, for example, facilities management function than construction and development. So hopefully we can use and have the resources on the team to be able to meet these timelines. And then obviously we are going to rely heavily. This is not just this team. This is many people, including the strategy and planning team, the healthcare delivery team, our data folks, right? We need everybody to help us contribute to these efforts. And I think we can do simultaneous work. And I will take this moment to also make sure that everyone realizes we are doing some work right now on Cameron Center and trying to really think about that care continuum for the medical respite population, people experiencing homelessness, and all the other healthcare needs that we might need to be addressing for some specific special populations. So that is also going on while we are doing this other work.
Thanks. I've got a question from Chair Rodriguez, then I've got Ann, and then Manager Musaitov.
Yeah, just a couple of quick questions. I think, and I know you're trying to work on these tables of contents. It's somewhere in there, will there be a discussion with the board of whether or not, like especially buildings that we own, whether we from a policy perspective, support them being lead buildings, whether it's platinum or silver or gold. I think there's some trade-offs there economically and from a budget perspective, but I think that's one that, I don't know where it goes, but that's an issue. I think the other one is I appreciate with the board's input around how you have this for the calendar year so that we can know what our own board outcomes and expectations are as we kind of set our board priorities. And the only other question I have is that the expectation at somewhere, and I don't know where this goes, but whether it's an appendix or somewhere, but ultimately at the end of the day, based on our fiduciary duty, a comprehensive list of all the facilities, right? I think you kind of distinguish them between those that we lease and we own, but also putting in there kind of the value of the deferred maintenance, because I think you've talked about old buildings, usable buildings. I think it's always important for the board to understand what the deferred maintenance is from an economic perspective of how much is really there, because when you do these comprehensive assessments, you will get that information. It's good for us to know that. The year of the building, the age of the facility, which is almost the same thing, age of facility, the square footage, a usable life. And I know you talked about the full assessment on some buildings and some other ones. I think for those that you don't do a full assessment, I mean, you're essentially telling us and you can economically show us this is the replacement value of that building, so that can be incorporated into the budget discussions and finance and seeing where that fits in for potential bond projects as we kind of set a cadence for those. But I just kind of didn't know where that goes, but I wanted to make sure that at least that expectation is out there about where that goes in that information, because that to me, like from a facilities plan perspective, ultimately that's one of the documents that I think as a board member you can really see and kind of really capture what it is that's needed and the obligations and responsibilities that we have.
And I will share with you that it's been our practice to attain Austin Energy Green Building silver levels, and so I think so we can talk about that.
So it's our practice, and I guess.
Is that a board policy, or is that board direction, or just the administration decided that's what they were gonna do?
Actually, I think this ties back to the downtown campus plan and some of the recommendations that came out of that. But it is not a set policy, and I think it has been directional more than it has been a requirement, for example. There are other there are some areas where we are actually excelling in this. So, but I absolutely can make this a facet.
Yeah.
With relation to a lot of the notions that Chair Rodriguez mentioned, it feels like those could be either more granular elements, subsets, or folded into the strategic framework and options to solve portion of the TLC. That I think is kind of at a high level, touching on 4 out of 5 of those things, I think.
Chair Motwani, may I ask just a clarifying question? So, Chair Rodriguez, I think if I was listening carefully, in the facilities review, there might be columns, in this spreadsheet that refer to the multiple items you mentioned. Would it be possible for us to just follow up with you offline and make sure we capture what those columns are, so it's part of the review?
Yeah, definitely. I think probably your consultants probably have a lot of that, but I just want, that'd be great.
Okay, great, thank you.
Chair Kitchen.
I have a question related, I don't know if this is within the scope of a facilities plan, so if not, we can address it elsewhere, but I'm wondering about whether we should be addressing policies related to construction and including original instruction and rebuilding or maintenance. And I'm thinking of labor policies in particular. And I don't know if that's appropriate in a facilities plan or if that's a separate policy. But I do think in the appropriate place we need to address what our approach is from a policy perspective on labor practices. And, and that includes level of pay, includes safety, construction safety, it includes a whole range of things.
Yeah, including, I don't know if the staff, like the Davis-Bacon Act, usually there's a policy in place around that for construction, and there's other things, but I don't know what the pattern or practice or the policy is here at Central Health.
So is it in the plan or is it a separate policy?
Historically, we've done it in the plan. However, it could be a separate policy in the Brackenridge or the original Brackenridge campus planning, that was something that was included in that planning. And it's also something that is appropriate for a policy. I think that is, well, whatever you guys direct.
I think it could be both, because I think
Okay.
out of the plan,
Okay.
I think is even described in the other policy is you might have these budget implications, policy implications of policies that we don't have that we'll need. So that, I think it just makes sense for both.
You do raise an
Okay.
interesting question. We've never had federal dollars, so we've never had to comply Davis-Bacon on our projects. But I think as we, strengthen our relationships and look for alternative sources, I'm not going to suggest, maybe Jeff will say no, how, federal funds might be applicable to our projects. So I think it's something we could
Yeah, but-
absolutely explore as part of this larger master plan,
Sure.
comprehensive plan.
Oh, I'm sorry, should I go? I'm talking beyond compliance, I'm talking about, what our policy is as a board.
What we will practice.
What we want as a practice for the use of our dollars.
And that's something that we absolutely can add into,
Okay.
we can add a bullet into the strategic, I agree, strategic framework and options to solve. That would be an appropriate place. And then also, I know there had been feedback on assessing projected geographic locations of patients. And I think that could fit into the needs assessment and future demand area. That would be on the next slide.
I have one question.
Manager Musaitov?
Okay.
Just really quick. So, for the comprehensive plan, for the properties, I think we mentioned, it was a request last time, remind me, that from each property, we asked about the services that you provide and the capacity for patients. So I was wondering, is this something that you have available, or is it are you working on this? And if possible, what demographics do you see within each of those clinics? It might be helpful for us as we're making certain decisions down the road. So if you can include that information, thank you.
Yeah, this kind of segues into Manager Musaitov. About, if we have a list of facilities, what is the capacity of the facility, and at what percentage are they at capacity? To help us plan, that would be very beneficial for me to make a decision about where we at and what we need to do.
Super. And there are a couple of things I wanted to also visit. Well, one of them, and I actually looked to my colleagues here for guidance on this as to whether or not it should be memorialized in this sort of inaugural comprehensive plan, is around lessons learned, not from us directly, well, ours of course, but just regionally, nationally, but particularly regionally, and I look at Austin ISD candidly, and lessons learned, any applied learning particularly is related to like sort of economic and therefore contingent demographic shifts. I mean, and I say that because the economic segregation here in Austin, I mean, it became hugely evident in 2012 to 2016, and it's like a very slow moving train, and we kind of all saw it coming, like, oh, here comes that train, that train's coming, here comes, and then precipitously, despite a very comprehensive and thoughtful planning process, we've seen the closure of buildings that were often recommended for investment, through very thoughtful and comprehensive processes. And, we can't see around every corner, but I feel like there's value in memorializing that somehow. I don't know if that should be here or not. I wanted to know if anybody else had thoughts on that, staff or board.
I'm hoping that these consultants will bring that to bear. That's going to be a part of the analysis that they bring. they might recommend that we do long-term ground leases in certain areas because that's not where the population can get to, and we should, locate elsewhere. So I'm looking forward to their informed analysis.
Okay. And then the other thing was around cadence of updates. It's kind of a housekeeping thing. I don't know if it was noted in the content areas here. Was it?
The last one, I think.
Yeah.
It's the last question.
Triggers in process. Great.
Yes, and I do believe that as part of, when we develop scopes of work with the outside consultants, one of the first parts of that work is actually proposing timelines for deliverables. And for folks who have been part of these planning processes with Central Health before, one of the things that we'll bring back to the committee out of the gate is a proposal around community engagement, around additional timelines that will feed into committee and board review of different proposed activities, additional board feedback, and then when deliverables can be expected.
And thank you, and my apology for the oversight. And the notion around regional needs, at least regional, when we're talking about extra Travis County, did any of the board members have any thoughts around that and how it may be included or intercalated in the current content areas, or whether it should or not be?
I think for now, we should probably hold off until we get more information. Perhaps has there been a conversation with other regional, across, outside of Travis County? If there's active conversations, maybe perhaps to start, or to start initiating those conversations if that's the will of the board. But at this moment, maybe we just focus what we have right now, unless there's further conversation outside.
So I'll come to you, Manager Valdez.
Eventually.
This might be a good conversation to put in the strategic plan, because if in the strategic plan, you're talking about potential collaborations in the region, then that'll feed into
That's
the
right.
facilities plan. But that's one approach, it might be.
So what I'm hearing is that if it happens like that, there's a good probability that that conversation isn't fully cooked until probably update time for something like this. If that sounds okay to you, in as much as procedurally how it goes, since it seems like according to, or per the feedback of Manager Musaitiv, right now, since those conversations haven't really been thoroughly initiated, it may be premature. Does that sound okay?
That sounds
side
okay.
of
The only reason I was wanting to make sure that we at least consider that somewhere, either here or at least there first, especially with strategic, because I'm looking at 4 years in the future, and I'm also looking at what we've seen so far. And there's no way that we were prepared for something so destabilizing in this region as what has occurred with the federal changes to laws, priorities, et cetera, protocols, and funding. So let's put that on our list.
Yeah, I'm not sure where we landed, because I'm not sure we should wait, so.
Where I felt like we landed in that moment, of course, and we haven't landed absolutely there, was that it may not be housed in this plan, but might rather be housed in the strategic plan, until at which point there would be either mandate or board guidance to bring it to the facility plan.
Okay, and remind me what it is.
The notion of regional collaboration outside of Travis County, in as much as what it initiated, in as much as how it pertained to infrastructure. But
Okay.
I'd like to support Manager Vasaki said. We're in the middle of establishing multiple relationships currently, and I think we should broaden that reach to outlying areas and whatnot, but I think things are so fluid. I think that what your idea of putting the strategy plan to establish those relationships firmly in place, and then begin that process as our partners form then I think the infrastructure would then have to get involved at that point. But first, I think the strategy has to be placed.
That all makes sense to me. Does that sound okay,
It
Manager
does.
Valdez, that we've acknowledged it?
The only thing I'm taking into consideration is what I'm hearing and what I'm seeing with respect to the deaths occurring on our population by ICE agents and those that are acting illegally or outside their scope in which to act, and how that's impacting our communities and the changes that are occurring at a much higher rate in our communities.
Heard. So I'll kick, did we have Dockley?
Chairman Wani, just that there's an aspect of this that is just necessarily interdependent with our adjacent counties. Sendero serves 8 counties. Community care serves our, all our adjacent counties, at least close to Travis County. There's a flow of patients who come in for our homeless services because there's a differential across the border. And then all of our sister districts, Parkland, Harris, University Health, they all, at every THOT meeting, pretty much remind me of the flow across their neighboring counties. This is a phenomenon we see in all the major urban districts. So I think, and Dr. Musek made the point about cancer as well, I think we are already understanding that the access to care in Travis County is very different than in surrounding counties if you're poor and vulnerable. And so I think there's an inevitability that we're going to have that in view, and it will likely inform some aspects. Not necessarily that we're changing structural aspects of how we work, for example, but that we know there are people from surrounding areas who need care and they will come to us for care, and we need to keep that in mind.
Given what everyone's saying, it makes sense to me that that conversation might be had as part of the strategic planning process, as I think the chair recommended that, so.
Okay, so through the lens of this conversation, not much amending that needs to happen on that particular item. And is there anything more related to the content areas or the earlier elements of the presentation that anyone would like to comment on, ask questions, or revisit? Brilliant. Well, are we going to go into that? I don't think there's a need to go into closed or anything like that for the additional item, right?
No.
Okay. So with that said, well, thank you all so much for your work, for the presentation, and again, for your work. You all have been at it. I would like to now go back to agenda item number 1, which was review and approval of the minutes of the 17 November 2025 Infrastructure Committee meeting. And so, thank you, Perla, for bringing the word-for-word sort of transcript here. And what I'm going to do is reread what that said. I remember now further that, there was a discussion where it felt like we were moving toward a head as related to some direction. We restated the motion, but there were some very clearly tangible elements here. So I'm going to reread this. As I was speaking at the end of the meeting, I was saying there's substantial interest for the board to re-engage around the Brackenridge Master Plan by re-examining community sentiment documented in the 2016 documents. Between then and now, through the lens of fostering cultural and infrastructural continuity in that tract, and between the east and central parts of town, and through the lens as well of harmonizing the master facilities plan with the healthcare equity plan and looking at what kind of North Star strategic plan that might comprise. Not that we need to do all these things, but we should open re-engagement. And Ann followed up with 5 particular documents. Wanted to make sure we had itemized 5 particular documents as part of the motion. The first of which was the actual master plan document that was approved by the board. The second was the PUD for the City of Austin PUD for that track. The third was the Capitol View corridor policy and any documents or implications related to CVC on tract, the Capitol View corridor, and any official vote or motion that moved the board in a different direction, and the relevant real estate policy. Now, I think, well, there are two pieces of this discussion. Number one is, can we clarify this motion so that it can be codified, or at least printed back into the minutes? And number two, and this, we may not be posted for this, so David will keep me honest, can we, assure that we've gotten these deliverables, these 5 documents? Yeah?
Yeah, I'm reacting to the language here about restating the motion. Recommend to the board that we reopen engagement on the above stated principles and provision of 5 documents. That's fine. That what's missing is the above stated principles.
above-stated
There's nothing
principles.
in the minutes that say what those are, and you just read them, so.
Yeah.
You can fix the minutes just by adding that first paragraph.
And so I am happy with doing that.
Yeah.
If we just verbatim put that first paragraph in there, from there to re-engagement, I think that's great. Super.
Captures it.
Does the committee have the entire committee have a copy of this? The infrastructure committee doesn't all have a copy of this? Huh. Well, I'll give somebody my copy, and if y'all wouldn't mind reviewing it.
Just have somebody,
I'm happy to share, I just,
Oh, okay,
for my
great.
personal notes, I can.
print it and send it.
Well, just so we could vote on it. It'll come back to us whenever we get the.
I've got it. I'm good.
My apologies for my PUD. What does it stand for? Can you remind?
Plan unit
Plan
development.
unit development,
Oh,
under the zoning ordinance probably.
Would you like a motion, Chair?
Yeah.
I move the committee adopt the corrected minutes with the addition of the paragraph that the chair just read. Is that clear? Do I need to read that paragraph? Nope. Okay.
I'll second.
We have a motion from Pastor Kitchen, a second from Manager Musaitif. Any discussion? All in favor? Aye. It passes. And now, inasmuch as the journey is concerned, I just as we talk about the next infrastructure committee, I do want to make sure that we discuss each and ensure that each of those documents has been provided to us satisfactorily. And I don't want to get into that discussion more profoundly now so as to stay on agenda. But if we could just make sure that it's on the next infrastructure committee agenda. And on that note, we don't have a currently scheduled infrastructure committee meeting. You'll be hearing about it as soon as we know.
You can do item 3.
Oh. There is no presentation on the item. Staff is available to answer any questions on item 3. If you received the memo. So let's move to item 3. It's to discuss Central Health owned or occupied real property and potential property for acquisition, lease, or development in Travis County, including next steps in the redevelopment of the Central Health downtown campus, administrative offices of Central Health Enterprise Partners, and new developments in eastern Travis County.
Did we discuss that? Or is that a new item?
It's a new item if we want to discuss the memo that we received.
Oh, no.
That's, if you read it,
I did not read it. I did not see it.
maybe bring it back up next month after people have looked at
Chair,
it.
the attorney-client memo that's referenced, was the subject of? Yeah, was that the one related to the PUD, or was that a
It was,
different one?
I believe it was related to the
Downtown
downtown
property.
campus.
Okay, I've got that already.
I think David emailed it.
Yeah,
Yes.
I got it. Okay, no questions.
No questions. So, as I was saying, we don't have a scheduled infrastructure committee. We'll let you know as soon as that happens. There's a high probability we will, given the work streams and the rapid pace at which they will be occurring. And I'm ready to accept a motion for adjournment.
Second.
And all in favor? We are adjourned. Thanks, everyone.
Members, dinner is in the other room, so I thought we would take a break and go do that and then start our meeting at 6 o'clock, so that gives us about 11 minutes or so. And let's see if we can come back by then.
Okay, thank you.
Good evening. Today is January 14th, 2026, and it is 6:04 PM. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Executive Committee. As a reminder, some of our committee members may be also participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. And as a point of personal privilege, I just want to mention three real quick items. I think one, I'd like to welcome our newest Central Health Board of Managers, Sadora Jefferson, to the Central Health Board of Managers. And then,
Thank you.
and then before we ask her to say a few words, I don't know if Dr. Lee, if you've got anything you wanted to say before we invite our newest colleague.
Yes, thank you, Chair Rodriguez. Sadora, Manager Jefferson, on behalf of the staff, we just want to share how excited, honored we are to have you committing this time and energy and wisdom to join us. You know, we know about your lifelong commitment to the mission that we serve, the integrity, the thoughtfulness, the balance, the rigor that you bring to the governance duty, and also the trust and deep experience you bring from our CUC board colleagues, especially now, especially given how much all of us, and Dr. Yagoda and I, in particular, are just committed to this idea of the best of both worlds. A hospital district in Texas built around a huge and high-performing FQHC where we can create access for everybody, whether that's through MAP payment, Medicaid payment, Sendero payment, truly the heart of a future health system. And to have you on our board at this time, it's just a real gift. So thank you for your service, and thank you. We're excited for the work together.
Well, thank you. Everyone's been very gracious and welcoming and hugs, and I want to thank you for your openness and warm reception. Part of me feels like I hope, I hope things haven't been built up too much and then I'll, be a disappointment. But I am bringing my full self, whatever that is, and I'm looking forward to being a contributor and a team player. And I I feel like it's a privilege to be at this place at this time, given everything that's happening, in society with so many things. But healthcare is one of those things that's really being shaken, in terms of our institutions. And so I'm glad that I have an opportunity to try to be a part of the solution.
Thank you, Manager Jefferson, and welcome again. And it won't take too much time for some of the issues that you just described at the end, because the next two quick items, one is, members, I just want to make sure you have on your desk a copy of a email regarding an issue that you'll have an opportunity to ask questions in executive session. We talked to our counsel about that, but we want to make sure that you have it. And I think, are you distributing it?
Yeah.
Yeah, so I'm sorry. There's two items. I think one is the one that Bedla is describing, is sending out.
We can't discuss it, we'll put it on a future agenda
Right,
item.
yeah, and it'll be, if you can just read that and return that back to Bedla. And then because we're not posted for that particular item. And then the second item is one that we can have questions in the in executive session. But I also, the last thing I just wanted to mention is very timely that today there was an announcement by the federal government around SAMHSA funding, and I wanted to give Dr. Lee just a quick opportunity to kind of give us an update on that.
Thank you, Chair Rodriguez. And the brief information I have to share with you comes by way of our Integral Care colleagues, so appreciate. We've been in contact through the day, and what you have in front of you is just a brief summary of the net impact that we're aware of so far to Integral Care, which is approximately $1.2 million across these 4 programs, impacting 14 FTEs and about 641 individuals who receive care. On the following pages, you see a very brief summary of each of those programs that's affected and its significance. So you have this as just a brief as it's breaking news and for your awareness. Thank you.
Yeah, and members, if you have questions, feel free to follow up with Dr. Lee around that, because it's not a posted item, so there's no, yeah, yes.
I have a process question. I'd like us to take up conversation of this, so I guess it would be appropriate at our next Budget and Finance Committee meeting or next board meeting. And I'm sure, Dr. Lee, that you and your team are doing this, but I would like for us to be able to discuss the impact on patients and whether or not there's any action we might choose to take.
I think if you can discuss that with Dr. Lee, I think one
Okay.
of the questions I have is, if it's an action item, it might be something that we send to Budget and Finance. If it's
Okay.
an informational item, it might be okay to just send it and have it in our board meeting.
I'd like
If
it
that
to be
makes
an
sense.
action item.
You like it to be an action item, so we can talk about that in our other agenda items here, because
Sure.
I think that's one of the things that the executive committee can
Okay.
provide input about where topics go.
Okay.
And so that's a really good one to kind of have a discussion about. Thank you, Dr. Lee. I'd like to announce that in order to make it more accessible to community members, we previously held public communication for the Strategic Planning Committee, Infrastructure Committee, and other executive committee meetings at 3:30 p.m. Unless a member of the public wishes to comment on a specific item on this agenda, we wanted to see if there was any public comment, sorry.
Sorry, can you repeat that?
Unless a member of the public wishes to comment on a specific item on this agenda, now we'll move on to the next committee agenda items. So I don't know if there is there's no public comment, there's no one that signed up for public comment, so we're now gonna proceed with the committee agenda. The first item is approval of the minutes of the Central Health Executive Committee for December 17, 2025. And members, if you've had a chance to read the minutes, I'd welcome a motion. Yeah.
I move that the committee,
You're
I move the committee approve the minutes of the Central Health Executive Committee, December 17th, 2025 meeting.
Thank you. There's a second? Okay, having a motion and a second, all those in favor? Aye. So the motion passes unanimously. We'll move on to the next item, which is to receive and discuss the prioritization and tentative scheduling of items for consideration at future Central Health Board and committee meetings. And this is a good place to, well, I'll let Bella, you want to start, and then we can talk. This is a great place for the discussion that we just had.
Right, and we can tag team on this, but this is the list of tentative, scheduled and tentative meetings and respective agenda items for the remainder of the month of January and for the month of February. At this time, they were in your board packet on Friday. At this time, staff is seeking feedback on any agenda items we may have missed or any information, and we've also included the board decision table in there as well, and we'll be populating agendas with those items as needed. Chair, would you like to add
I'm a
anything
little
to that.
confused, the dates here. Are you referring to 2026 or 2025? So it's all referring, so,
These are 2026, I'm sorry, that's a typo.
because I was confused, so I'm just trying to understand, like,
Yes,
okay.
good catch, so
And even
we
the
will
committee
update that.
assignments is 2025, so I just want, I know,
We used last year's template, so we probably just
okay,
forgot
so
to
it was confusing
update.
on my end, because I was thinking, I was looking through the agenda, to the packet, I'm like, oh, okay, what is this reference to last year's committee assignments, and,
Yeah, this is
okay, so that was a
us
typo, thank you
still
for that
not used to
clarification.
using 2026.
Okay, thank you
We are
for
in
that.
2026. And then Chair, did you, I don't know if you wanted to add anything to that, to this about the, intent, your intent?
Yes, a couple of things here. One, thank you for that good catch on the
Yeah.
2026. Happy New Year to everyone.
Yes.
Welcome to 2026. I think one of the items, as Manager Valadez had mentioned before, that we want to reiterate is we are going to be recording our executive sessions this year. I think the other one is that we're gonna, in conversations with the vice chair, we're trying to see if we can use his executive committee for input and feedback about where issues go, whether there's something that goes to the board, whether it goes to to a particular committee, or whether that's a subject that's not relevant to the governance of the organization. So I think what we're trying to do is create a cadence around this whole receiving and discussing the prioritization and scheduling of items, and you see this list of items, so that I think one of the approaches that we're gonna discuss in the next item is asking each board member what their board priorities are for the year, to just make sure that we incorporate them and what issues might be of interest to them. Just because I know that we work as the will of the board, but we want to make sure that whatever issues any individual board member has, we put them down here, and then we discern whether or not it's out of scope, whether it goes to a committee, or whether it should go directly to the board for either action or for information purposes. But that's really the purpose of it. I think the other thing is that we started off the year pretty early with these meetings, so I've not had an opportunity to talk to all of our board members about what interest they have in moving in different committees, or they want to stay in the particular committees that they want to. And I think without bleeding into item 3, I'll stop right there, because there's more there. But I don't know, Betla, if there's anything else you want to add, or at least I don't know if I'd invite you to add anything else.
I think you've covered it at least from the preliminary thinking that we've had
Yeah.
at this point.
Yeah, and
This just a FYI, the CUC Liaison Committee meeting should have posted today.
Today, it
Yeah, it's
posted
got
today.
2 additional items than you have listed here, so.
Okay.
So that's just FYI for everyone, a
And-
follow-up on the retreat, as well as a follow-up on the employment agreement.
Right.
And I would just say that this is a living document, so it's gonna change as we have our priorities and things change. But I think this is trying to make sure there's transparency about what items are outstanding, where they're at, what are we gonna consider. And I don't know, Betla, if you wanna add anything else before we move to the next item.
Right, we're also staff, just based on the board's priorities. There are also a lot of statutorily required agenda items, and so just know that staff is also working on a separate document that's a work plan for the year. And so at some point, we might share that with you just for informational purposes. And the decision, I'll also say that the board decision table, my understanding from our former chair, Kitchen, is that that's also a document that will be updated based on board, priorities.
And Betla, I don't know, do you have a copy of
Yes.
the first, because I just wanted, out of transparency, can I show you when we have a one-on-one meeting with Dr. Lee every 2 weeks set up to discuss, and this is sort of the agenda. And again, when we do those meetings, they're not decision meetings, they're about what items we need to cover an agenda set. So, for example, there's the updates from the previous meeting, just kind of giving accountability to all of us, an agenda setting of board calendar items, the governance issues, administrative issues, and next steps and accountability. This is a way of making sure that we're all on track and holding each other accountable. I think for me, more and more, those items, those meetings will be less and less time, and the major issues are gonna be here if there's a decision to be made. Because that is just meant to set up kind of where we have issues, or if there's an issue that comes up. But I think this is really, the executive committee is the body that's gonna be directing kind of where we go, and I hope we can create a cadence around that. I know in reviewing some of the meetings, and we'll talk about it in the next item, and in reviewing some of the meetings that we had last year, there was particular 2 or 3 themes that required us to have a lot of meetings during that time period, and we'll go through that in the next item. But Pedro, I don't know if there's anything else you want to add. Oh, I did have a question for you all. Like, and you don't have to answer it right now, but are there any other agenda items that we're missing here, or is this kind of the appropriate kind of items to discuss? I think we worked with administration because I had drafted kind of some items, and then they came back and said, well, no, we have to have some of these others, and so we kind of worked together around this. Yes.
Well, I can, about my meeting, definitely there's one outstanding item, which we never really discussed fully. It relates to funding organizations, nonprofit. So that nonprofit, our philosophy around funding outside, and you remember how we?
We did, yeah, and my recollection, the conversation we had late last year is that could, I think, also simultaneously or in parallel be discussed as part of the conversation around policies, key policies for the board.
Yes, and it was around board recommendations. I think we need to revisit that item.
Okay.
If I may, I did ask Monica about it when I had a meeting with her earlier this week, or last week. She did indicate, she said that she thought it was completed, but she said she needed to check with you, Perla. So you all just kind of figure out where are you in that process, and bring it back to us if you would, please. Because
Okay.
especially now with, as we know, there's moving parts to funding issues.
Right.
Yeah, so if we can add that. And another thing, I want to also bring it to your attention, Chair. Like sometimes there are present items that we may not know about that come during our agenda setting meetings that we need to add. So just also want to let you know, sometimes there are items that we bring forth. These are usually the standing items.
Yeah.
But just for full transparency, I know we post our agendas, but this is not really a comprehensive list of all the agendas, and we may or may not take certain agenda items as well, depending on what information is available, time limitations. Because, for instance, in the past, we had to pivot somewhat. So staff has been very flexible, and the board has been as well. But we usually prioritize pressing item agendas over items that could be presented in a packet for a member to read on their own. If they have questions, they can go back to. Usually, our standard practice is they'll send that question to now Valerie or Brianna, and they will distribute that question to the appropriate person. That's what's been the standard practice,
Right.
correct? Remind
And
me, Perla.
I think that's a really good point. Some of these agenda items, we'll start clarifying which are presentations and which are backup material only. And you're right, sometimes we do have to pivot because of timing issues, and sometimes we have to pivot because there's a urgent item that needs to get on an agenda that may not have been presented in this tentative schedule. So, I mean, this is a living, breathing document that changes.
So I think that's it for this particular item. I wanted to move to the next one, if that's okay. So, sorry, Ann, did you have a question?
I don't know if you want to address it here or the next one, the point I raised about
The issue?
the issue related to funding.
For it, on the
Do you want to address
SAMHSA.
that here or next? or
I
next?
think no, we should address it here, I
Okay.
think. Yeah,
It kind of, okay, it relates to what you brought up also, which was the policy on what we might consider funding. So I think it needs to come forward and probably Budget and Finance, but that's up to you guys to consider. Because Budget and Finance can act as a whole, or you can bring it to the full board. But I think it's an item that needs to be discussed, particularly in the context of the policy that you just mentioned. So. that-
So if we can add that?
Budget and Finance.
Add it to
For next
Budget and
month?
Finance, yeah.
yeah,
Add it to Budget and Finance.
that'd be great. That's really the purpose of, like, this conversation.
Okay.
Is a good example of, where does that issue go and.
And then for informational purposes, on the CUC Liaison Committee, the cadence of those meetings we'll have a better idea of after our committee meeting next week.
Thank you. Members, any other scheduling items or anything that we need to talk about right now? Yes, ma'am?
I apologize for, I know I'm not a member of your committee, but I tried to raise a question at a prior meeting and was shut down. So I didn't get a response to it, but I'd like for you to please see whether or not you can ask staff to tell us if there are any issues that impact Central Health, that whereby Central Health may not be directly named in a concern, a federal or a state or local concern, but that dollars that were used and received by Central Health may or may not have been accounted for appropriately. And as a result, the state or another jurisdiction has a complaint against it or action that needs to be addressed, whereby we may or may not have been indirectly involved. And I can give you some paperwork regarding that. If you need it, I don't have it right now, but
Yeah, I think if you give that to us and we can work in consultation
it.
with our council
Yeah.
and review it, and then kind of see where the appropriate place is for something
Because-
like that.
yes.
And if I could, just to elaborate, or not elaborate, but just further get clearance, understanding on it, could this issue that you're raising, could it have been part of the audit, the SARS audit?
I don't know exactly, because I didn't look specifically for
Sure.
that, but it would have been a concern or an issue that was raised with the State of Texas Health and Human Services Department for monies that were received from the feds and distributed by them to the healthcare districts or to those that were funded to expend dollars under IGTs or whatever.
Yeah.
So I just want to know if we have anything else out there that would or could directly impact monies that Central Health had received or expended, or somebody may try to make us responsible for reimbursing them. And I'm talking about maybe HHSC. And I'd like to know whether there is anything still on the books or whether they were resolved.
I think
Whether
the-
they were resolved.
Yeah.
And if y'all can find out,
Yeah.
and I'll send you as our chair the information I have.
The process I'd love is like, if a member has an issue, a concern, to send it to me.
Okay.
We'll work in consultation with our attorney about the appropriate place in the agenda. It might be, for example, some of what you're describing might be risk management, so we might have to include our compliance officer.
Okay.
But I think I'd always want to start with legal guidance around that issue. And then we can find the appropriate place, whether it's information back to the board under attorney-client privilege, or whether it's an informational item or whether it's an executive session of our board. But I think when you send that item, we'll work with, in
problem.
collaboration with legal
Thank you.
to figure that out. But thank you for bringing that up. Members, any, manager, good?
Just quickly, the compliance officer report back to us, I didn't see it on here. Do we know from her yet? I think that might be February.
So, the compliance officer, I know she,
She's supposed to
she will be giving a presentation, to the board on January 28th
Okay.
related to, conflict of interest, policy, and there might be some other items as part of that.
Great.
Well, but she's supposed to be bringing back to us her plan
Mhm.
and what her reporting cadence will be to the board. So
Okay.
is that the January 28th?
Pat, I don't know if you have any more detail on that. Sorry, I caught you.
For the bite.
But,
Sorry about that.
but what I will share is that she has reported to us at the executive team that she's working on an assessment and she's reviewing documents. So
Okay.
I think if she's ready to present the plan, I know she's also reviewing the previously approved compliance plan and doing some due diligence. So I think if she's ready on January 28th, if not, it might be February.
Yeah, we can put that on our list of items to make sure
Yes,
we
put it on the
know
list of
where
items.
where it ends up, yes.
Good afternoon. This is Nakia. I don't know if you guys
Oh.
can hear me.
Hi, Nakia.
Oh, hi.
Oh, hi, Nikki.
Hi, hello. Sorry I'm not in the board meeting today, but I just wanted to add some clarification. That's correct. In the January board meeting, there are a few items that I'll be bringing in there. They're the compliance program documents that lay the foundation of the compliance plan. I'm actually going through a risk assessment now, including the gap assessment that Coker presented to us, and then I'm also conducting my own baseline risk assessment, and it'll probably be through the February board meeting just due to timing.
Yeah.
So foundational documents in the January 28th meeting, and then the February meeting will be a more detailed analysis.
Yeah. Thank you. Thank you for that. That's excellent. And just let us know if you need more time, but that's great information to have.
Awesome. Thank you.
Yep, thank you. So we'll keep that item on there until it gets placed, then we take it off the list.
Okay.
Anything else, Mel?
I don't think so.
Okay, so we'll move on to item number 3, review and discuss central health committees, including their scopes of work and membership. And I think you have that in the package. And I don't know if Manager May, if you want to add to this, but I think this is real short. So since we've begun the year, we have not had a chance to talk to all our members about the committees and the membership, whether they want to stay in that particular committee or want to move to others. I think one of the things that we did discuss with the administration is, I think they documented 86 meetings last year. I think one of the things that in consultation with the vice chair is eliminating the ad hoc litigation committee meeting and putting that as a standing item in our executive committee and in our board meetings so that it's always there as an opportunity to talk. I think there's also an opportunity to eliminate the ad hoc philanthropy committee, which Elisa chaired, but now put it under strategy. There was a thought that we needed to keep the ad hoc infrastructure committee meeting since we have that whole comprehensive facilities plan in there. And that the strategic plan obviously has the strategic plan to accomplish there. I think one of the ones, and Dr. Martin, we had not had a chance to talk to you, and I think on the document, it shows that we struck through ad hoc appointments committee, but we thought it might be, in terms of efficiency, eliminating that committee and putting it right here into the executive committee so that we all kind of move forward in an efficient way in here. So just though, if we do all those, just based on last year, we're eliminating 17 meetings right there, or 17 meetings.
So
Math is not my strong suit, yes?
are you eliminating the medical committee?
No,
Oh,
It's still on.
no, the Ad hoc Appointments Committee,
Oh, okay.
which Dr. Martin chairs as well, yeah. Yeah, no, the medical committee is there, I think those were the ones that were like, for lack of a better word, like low-hanging fruit about, oh, there's a way to make this more efficient, and with the goal of maybe cutting the meetings down by 50% for this year. And I think as reviewing the meetings from last year, just to be fair, like I think the big three topics were community care. I think there was an HR issue, and I can't remember, Bella, the third issue.
Strategic planning,
Strategic
like about
planning.
our future state.
Yeah, and so just to be fair, like those were the ones that kind of were the outliers, or that's why there was so many meetings. And so we're trying, just again, trying to make sure that we have quality time in the meetings and efficiency. And if there's anything else in here that you see, I think the other one for me is like, I see that we had 5 retreats last year. I think we're probably gonna keep 4 of them. But they'll be substantive, and there'll be an opportunity for the executive committee to kind of really give input around what the agenda for that would be and what we want out of it. And then obviously the ad hoc policy and bylaws committee, there's the big goal there is the policy of policies, but I don't have to tell that to our manager, but that's the big one. So a lot of these committees are sort of like, what is the board goal or board priorities in each one of these to make sure that we're leading and driving the governance piece of the organization. And so obviously budget and finance, like the budget is a big piece right there. So that's really what we're trying to do, is an alignment of what we're trying to accomplish, and a clear transparency around that, at least at the beginning of the year, and see where we end up at the end of the year. Yes, ma'am.
So with that, and I know we may not know now, as you're trying to bring in more transparency and streamlining all these meetings, like, when will be the appropriate time? I know, like, with the CUC stuff, to be not just on consent, like having a broader board conversation. Like, when would that appropriate time be? Would all that conversation take place in the committee that it pertains to that item? I just want to understand for clarification.
Yeah,
Or would this ever be brought to the full board?
Oh, yeah, I
How would
mean-
it
You
be?
have to bring it to.
Yeah, you'd have, yeah, I'd agree with Ann that it always, all these committees are discerning these topics, trying to get us to some sense of a final draft, if you will, that ends up coming to the board. The Board of Managers and the will of the board is what governs here. I think, and I've said this before, but I'll say it publicly, it's like, Dr. Lee represents Central Health, the entity, every day, 24/7, or maybe not 24/7, but, during office hours, maybe. Yeah, I think the board, and they implement policy, and then they do their procedures. We, the board, are represented by, if it's outside of the meeting, by the board chair. If it's in these meetings, the executive committee is kind of driving that as well. And then I think each of us as individual board members speak for ourselves, but the will of the board, the 5, that's us. Nobody represents the board. The board is the governance body, and the way we're represented is through our policy and through our motions that we direct our staff member to do. So that clear distinction, which is, from my perspective, I hope we have a visual around it in the near future, to understand that policy is our kind of realm, and that procedures or implementing our operational is obviously Dr. Lee and his team. So I hope that makes sense, because in the committee structure, then you're discerning that on behalf of the board, but we've got to have a full discussion in the board, and there's got to be a will of the board. And so while sometimes there might be some redundancy around, like, there's a full discussion in the committee, the real power is the board, is the will of the board, that majority of the board. I don't know, Ann, if you wanted to add anything.
Oh, I just wanted to clarify, I think I heard you say, and I just wanted to clarify, that the chair speaks for the board when the board's not meeting.
Only in particular cases where it's needed, but only about what the board
Yeah,
has
that's what I was-
decided.
I'm
Yeah.
sorry.
Yeah, thank you for that.
I'm
Yeah, it's
sorry.
not whatever I say. It is representing whatever the board has decided.
Let me restate that.
Sure.
So what I meant to say was that the board chair speaks for, on behalf of the board with regard to actions the board has taken.
Thank you. Yes.
Okay,
Yes.
thank you.
Yes, yes.
Actions, direction, motions.
Yes,
whatever.
it's very limited. It's not everything. And in other cases, it's, well, there's never gonna be a
But
case.
the point is that it's the board chair's role to speak for the board.
Yes.
Okay,
And that should be part of the clear governance of the
Yeah.
organization.
okay.
Thank you for that clarification. I think with that said, like, I just wanted to make sure that you all knew kind of the direction we're headed around the committees, and if there's any questions or suggestions, or whether we should think about anything else in here, that's really the question for our committee. At least I don't know if you have anything.
I think it's right in line with what we've been discussing. And we hope that as we move in this direction, that everybody will get comfortable kind of with how we're operating. And feel free to, as Geronimo said, bring whatever topics or questions you have, bring them to us so that we can try to figure out where's the best placement as we move into this new process that we're working on.
If I may, I think that's great, and I think it's a really good idea that the committees should delve into the minutia of the medical committee, and then bring that back as a gestalt to the board. I'm not gonna try and explain hemodialysis versus something else, but that we've done this and this and this. And I think the efficiency then really, really improves that way, that we all trust each other, we discuss this in committee, it's our suggestion, we do that. And I think that'll be really good. But I think to have the grand discussion with minutia and the whole committee, we get lost a lot of times.
And run out of time sometimes.
Yes.
To fully vet something that's important.
Something that pertains to that, if possible, if anything that was discussed in a committee and was approved by a committee and that needs to be brought to the attention of the board, rather than it be on consent, that it is an agenda item that has a summary, like a 2-sentence summary of overall what that decision was, approval. I think that keeps us all in the loop for folks who did not perhaps attend a certain meeting.
Yeah.
So that is.
Sure, and I think already, and I'm looking at David here, but I think the board members already have the ability to pull an item out of consent if they want to have a discussion about it. And I think that's probably gonna be, we're talking to the administration about a cadence of, for example, expecting all of our material, including background material, 5 days, 7 days before the meeting, and then maybe potentially having a responsibility on the board to require that we give questions 3 days before, so that way the administration has the ability to answer those questions. Doesn't mean you can't ask questions after that, but that we have an expectation that if we do it 3 days before, that they'll have the time to do the research and give us an answer back before we actually vote on an item.
Well, that's wonderful. I would love that. I would, just to reiterate my point, if there's an issue that was voted off in committee, and let's say you have it on consent, just bring it to our attention, because sometimes we may not be able to read that big packet. But if there's something that you want to bring to attention, hey, Board of Managers, just check out this item, just read it, just at least.
Yeah.
Just give us the heads up, that's all we're asking.
But I think that what Manager Rodriguez is saying is that can be pulled, and so could you explain this to me in more depth?
If needed,
I think that because the issue, I think what we're getting at is the responsibility of the board to read the stuff, get ready for the meeting, present the questions to staff beforehand, so we can, ask relevant questions and get relevant answers.
And to that point, we're gonna work with staff to figure out what is the most appropriate time that they can get the documents ready to us. They can make sure you have enough time with those documents to read and review. And then for those individuals who have comments or changes to the documents received, that you get those changes to the appropriate committee chair, so that way we can then turn around, send them over to that appropriate staffer and say, hey, we need to work on this. These are the changes that we need, blah, blah. That way, when you come in, our hope is that when you come in, you're dealing with a document that is current and we're not going back and forth on documents. Hopefully, we'll be able to do that. We were able to do that very successfully today, thanks to Ann's work. We got some clear direction on some items. We moved it. I called Monica, and we were able to get it. It put a little pressure on staff, but nonetheless, we got it done. And so we want to move in that direction, hopefully get more so that we're operating in that direction.
This is a longer discussion for later, I just want to note it, and that's the use of the message board. I think that would be something that, once we all are familiar with and learn it, it's a way for us to give each other a heads up.
Yeah, thank you for that. I think when our one-on-one touch point discussion, we talked about the message board, and we'll probably, I don't know.
Yes,
So I asked them to consider maybe having IT here 30 minutes before our board meeting in January to offer to our board of managers some IT help around putting that message board on your phone, so that way it's available and you can kind of figure it out. I know I need some help around that, but also some short training on how to use it, because if we use that message board effectively, we'll be able to communicate outside of the board meetings transparently and in compliance with the Open Meetings Act. That allows us to kind of make sure that we're going through and dealing with easy issue. I don't want to call them easy issues, but I guess easy issues, so that when we're talking in the board, as Elisa mentioned, we're really talking about, there's some tension here, let's have a conversation about what direction we as the board want to go, and then there might be some other tension with the administration and the board, but at least we're having those discussions and trying to work things out in the message board before we get to here. But again, to Dr. Martin's point, like, this is a pattern, a practice of how we do these things.
Being a Luddite, I have a question about the message board. So say, I mean, this may be for the attorneys, say there's 5 of us, a quorum, discussing things. I know if it's open, does that satisfy the legal?
Yeah, it does.
And it's open, but I think it's the understanding that, oh, by the way, this can be read by everyone.
Yeah, the thing you have to, do I mean,
Here, go ahead.
I use the message board all the time when I'm on city council, and it's available to all governmental entities, it's state law. What it lets you do is talk with all the board members. You have to remember that whatever you're posting is open to the public, so you don't want to be saying things that aren't appropriate for that. But it is a very good way to comply with open meetings and still communicate with the board.
And I'll just add that tomorrow, Valerie or Brianna will send out the policy for use of the online message board, and we have like an instruction sheet. And if you need help, if you're having any issues posting or need help, I think we were going to schedule some office hours with Joint Tech in advance of them on the next couple of Wednesdays when we have meetings.
Oh, good.
Yeah.
More opportunity. Yes, ma'am, sorry. I know I keep looking this way because this is the executive committee, so apologies. I gotta
Right,
turn
and
around.
So on the suggestion about flagging issues that might be, that were, I guess, heavily debated at the committee level so that others would know, I would like that, being new to the board and not being familiar with the issue, something might just read on the consent agenda as being very banal, just kind of harmless. And so if you know it was heavily discussed at the committee level, I think the board chairs and kind of helping you come up with the agenda can just make sure it's a discussion item before it's voted on at the board table.
Yeah.
And that would be helpful. I would appreciate that.
Yeah. No, this input is really helpful because that informs, I think, our touch point pre-meeting before the executive committee and the board.
Absolutely.
Cynthia, you right?
Great.
Anything else?
Do you want to address the seating order?
Yes. What we're thinking about in terms of, because Elisa and I were both there and there. We were gonna make a suggestion about a new seating chart that took into consideration, obviously, the officers, Dr. Lee, and all of our board members. And what typically I've seen done is by tenure, by how long folks have been here, and so but I don't know if you all have a different suggestion, because I'm open to however y'all want to do it, or lottery or whatever, but yes, ma'am.
The way, okay, this is the last time I'll mention city council, but the way we used to do it for that is we would rotate. So I think it was 6 months or so, I can't remember what the cadence was, but say it was 6 months. Every 6 months, we'd shuffle them around, and we drew numbers about which seat we were gonna be in. And the reason we did that is because council's different than this, but who you sit next to gives you some opportunity to talk with them a little more, perhaps. And so it was just a nice way to relate to each other and to mix that up.
Yeah.
I don't know that that's relevant here. I'm just mentioning it.
No, those are two different ways of doing it. But
So it wasn't a hierarchical thing at all. It was a let's all work together.
Yeah.
You know, or get to know you. Yeah.
And I'd love everybody's input on this. I don't.
I think seating, I think that's a good idea, Ann. I personally would love it if our CEO sat next to our chair. I think for just that dialogue, that important relationship, I mean, just the curbside and say, you know, I think for me it would seem more efficient, that's all.
Yeah. In my experience, I would always lean on the superintendent and ask about timing questions, legal, there might be some issues. So we'll take that into consideration as we've been talking about how to make this square a circle, more of a circle. But I think probably that also probably, Dr. Lita reminds me that as we think about the new building or the upgrade on the building, that there's an opportunity for the board to have input on what that boardroom and the conference room, or whatever structure is there, it's a community
That
room.
San Antonio table.
So,
But-
again, I'm not disagreeing. It's a personal thing for me. I like to see the audience personally engaged, so to me it's very helpful, especially when we're discussing certain matters. If I'm behind their back, it's really hard for me to read. So it's just a personal I don't know if there's a way we can arrange our seating or somehow.
That's why I like my chair over there.
I
can see them very well.
So again,
did
this is
say
just
that.
a personal preference,
Yeah.
if it's possible, but I definitely prefer this side. Sorry, with all respect to the other side.
Well, I think maybe we oughta, I don't know, like if I'm taking all y'all's input, it's like rotating. I mean, we can rotate every 6 months. Maybe we draw numbers and see where everybody's at. And if Maram ends up over here, maybe somebody wants to switch with her. Or if she's over here, she gets to pick where she's at right now. But the idea is to make sure that we all kind of just make sure that we're comfortable wherever we're at. So I think we can work that out. But I think we have enough input to try to see if we can recommend something to the board. I think what we'll try to do is not implement it probably till the February meeting, but maybe propose and have that opportunity in the January meeting where we draw and kind of do all that, so that we have an opportunity to kind of see where we end up, if that makes sense. Or maybe even sooner than that if we have any more committee meetings before our board meeting. But I just want to make sure any other input around that particular issue.
I do like to see the board officers at the head of the table or somewhere, so that reinforces this is our board leadership, and that our public also becomes familiar with who and what they are. And so that when they see you at the grocery store, they can stop you and, what?
Why did you cut my insurance off?
Why are you going up on our taxes? That's gonna be,
Oh, yeah.
that's gonna be of importance anyway.
That's not a topic on the agenda, right, for today. Let me see, so we're on item 3,
Yeah.
and we're moving to 4, unless y'all have any other questions. I think on item 4, receive and discuss input regarding annual Central Health Board priorities and the process for considering board member requests. I think we talked a little bit about this, but I wanted to bring it up. That one, and I'll start with the board member requests. I think that asking the board if they have an issue or something they want to do, just like you all just mentioned to us, and just making sure that they know they can let us know on the board and copy Dr. Lee and Elisa, that we can kind of manage where that issue is going to go. And some of it will be items during the day, like the example today about SAMHSA's announcement that they've cut all the funding issues. Does that go to a committee? Does that go to our board? Or can that just be an informational item that we just bring and educate you all right now? Because Dr. Lee was able to get that information from Integral Care about there's no impact to Central Health, but there's impact to our partner. It's just different issues will dictate that, but I think we wanted to make sure there was a cadence of there should never be a time where you think an issue you have is not going to be addressed somewhere. And so we'll try to make sure and incorporate that somewhere in our governance structure, if that makes sense. Rob?
Yeah, I am actually asked, and perhaps, as we're starting a new year, I'm all about transparency. It might be also helpful for us to know what outside conversations with other entities, with our groups, who we are meeting with, just at least we're all in the loop of what it is. And if, let's say you delegate a certain responsibility, just let us, perhaps just to be in the know. So that is perhaps something helpful for us and the community. And if we're out there on the, as individual representatives, on our own personal capacity, or in the capacity of the board representation. So just clarification might be also helpful.
Yeah, I don't know what to describe it, but maybe it's like on this transparency of these vice chair meetings, of having a place where it's I don't know what to call it, community representation, where we have members that are going and talking on behalf of Central Health. Because that way you'll kind of know where they're at, or where a presence is at, and maybe that's part of a report from the president, or somehow I'm trying to think of what the best place to put it in. But that's a really good suggestion, is just letting the rest of our colleagues know where we're going in the community.
So, for examples about the lack of the funding, right?
Mm-hmm.
That would go to, I think, a medical committee. It would go to budget and finance simultaneously, because they're synergistically. I mean, we're here to serve patients' healthcare needs. So it's a healthcare issue. You have to, what are suggestions the medical committee might make? And the finance committee would do to bring that together. So it's not, I think, as clear cut as that, and big issues like that, but I think they could be addressed simultaneously with both chairs, for example, discussing it, and then bringing it up to the whole board.
Sure.
So let me ask a question. So for example, Geronimo and I, because we're chair, vice chair, we get invited to a meeting in the community. Obviously they want to talk to us about what's going on with Central Health, and maybe they even come up with an idea that they have a funding request. I'm just making this up, but let's just presume. So, is that something then that we bring back to Dr. Lee and share with him, hey, we met with so-and-so, this is what happened, or what the request was? Do we come back and make a report here? How would we handle that?
I would just think if you're talking to folks in the community on behalf of the board, that you would inform the board.
Yeah.
And also, not to interrupt you, Ann, but I think the caveat, the first thing to say to them is, I'm not speaking for the board.
Right.
That's number
Right.
one.
Right.
I'm happy to discuss my point of view, but let me make clear, because I think there's been some confusion about that.
Yeah.
And I think that what Ann is saying is correct, that if you have a communication with the outside community that seems relevant to the board, then I think to bring it to the whole board, we met with so-and-so is perhaps an agenda item or something to sort of say.
So to that point, and here's a good example, the meeting with UT, with the dean, how would that happen, or how would we handle that?
The chairs in the past have met with the dean for relationship purposes, and that's something that the board chairs have always done. And then reported back to the full board on any items that came up that needed to be discussed with the full board.
But the only items that needed to be discussed, not necessarily just coming back, just giving us a report, hey, we met with so-and-so, and this is what we discussed, that type of thing? We didn't do
Well,
that, or we do?
the discussion, those historically have been relationship building, they're not.
Right, but when we had dinner with the dean,
Yeah.
things brought up, and we'd met with the intention of just socializing.
That's right.
But it did sort of take but it wasn't the intent.
Well,
And
but
so-
we did not speak on behalf of the board.
No, I know, but she kept bringing up issues.
Well,
And
but,
so,
you know.
but anyway, but I think what you're saying is correct. I think those relationships where you're doing something social, where you're trying to build a relation, we had dinner with Bridget Shea.
Yeah.
Right, I mean, to build a relationship, you know, so you can begin, I don't think that's relevant to anything unless something's discussed,
Yeah.
so.
Yep.
And it might be a question maybe during closed session I have for outside counsel. Some kind of guidance and recommendation who is appropriate at this point in time to me and who's not appropriate in time, what the recommendation is that pertains to some core partners as we're moving forward with the next phase of whatever it could be. So
Yeah.
just, if I can have, I don't know if this is something that we can get guidance now or during closed session.
During closed session would be a really good suggestion, Dr. Musaitif.
Yeah.
That'd be great.
Thank you.
And I've also seen, Ron, where we might give some guidance to the board with legal input of exactly what you all were just talking about. Like, one, you're welcome to meet with whoever you want, including the press, but just make sure that you're very clear.
Yeah.
I'm speaking for myself
Yeah.
and not for the board. I
Yeah.
think that is a very good kind of thing to reiterate. And then there might be some guidance about what parties it might be, you might need to be aware of that you shouldn't be talking to. For example, getting notice when there's an RFP and there are people that are applying for that RFP. I remember getting, I don't know if the city did this, but we got reminders saying there's a current request for proposals or for services or goods. And it's important that you not speak about that. And so what would happen in that case is if a consultant came to me, I'd say, well, I'm sorry, we can't talk because there's a current RFP for your services.
That's a great point, but I don't think it was ever brought to our attention if there's an RFP out from Central Health. So that piece, I don't think we've ever received personally. I don't recall.
Yeah, it could be
But it's a good idea.
it's for me, it's a good governance perspective to keep the board informed so that they don't inadvertently have those kinds of discussions. I think on the other side, consultants and firms, they understand that role and understand how that could impede the decision-making, but it's always just good, it's a good thing to do. I don't know, Dr. Lee?
Well, I can give you another example. Oops,
Sure.
I'm sorry. Did you?
Well, thank you, Chair Rodriguez. I think we'd be happy to support any board members in this, whether it's an RFP matter, an idea for an RFP matter, what is the official position of Central Health on an X, Y, or Z matter. Please feel free to make use of me and Perla, and we can certainly direct the matter to the appropriate HR, finance, operations, communications lead, et cetera. And then in the appropriate fashion, depending on the matter, bring it back through the touch points, the executive committees to the correct committees. But I'm more than happy to field those concerns as they come up, if that's helpful.
Thank you.
Well, I was just going to give you an example. So, for example, I knew that I was going to be talking to a community member about something not related to Central Health, but I also knew that that person might have a relationship with Central Health. So I called Monica and got a heads up on the latest thing so I knew what to avoid if it came up. And so there's simple ways to handle those kinds of things just directly,
Yeah.
so.
And I
As
think
it turns out, it didn't come up, but if it had, I would have known, so.
And and Dr. Lee, as we work with our attorneys around this legal guidance, one of the things might be the last thing is if you have any questions, and then put down all of our legal contacts, whether it's David, Monica, or outside counsel, so that our board members can be welcome to call them just in case there's a just-in-time question as you're having meetings. But I think all of this is just good risk management. It's also good governance to make sure that we're all on the same page around these things. And then at some other point, we'll talk to it, I think, about responses, because I know David and I had a little bit of a conversation, or our Travis County attorneys, about whenever, and I think it's probably more clarity around it, but whenever a board member asks a question of the administration, whether it's appropriate to respond back and copy all of the board members so that they're all informed about the same topic, because we might have the same question, but we didn't ask. And so there's a little bit of discernment to be made around that, but I think that's something that I know we're trying to explore and kind of find the right balance for that as well. Whether it's like an individual question about themselves, or whether it's an issue for the board. Can the board do this, or those kinds of questions. But anything else? I'm trying to think if there's anything. So that was about the board member requests. The other part of this was about Central Health Board priorities. I think as we continue to move in our transformational changes in healthcare, I mentioned this, I think, at the beginning, is asking our board members what their own priorities are and seeing how those might align with what we're doing to make sure that we're incorporating that board member's interests into the governance of what we're doing. So trying to make sure that we are focused on the things that our board members think are important as well. So that's what that is. So you'll be hearing some more communication around that particular issue. And I think, unless members, you have any other questions, or staff or Dr. Lee, if you've got anything else, I think we're ready to move to the next item. So we're good. So I announced that the committee is convening in closed session to discuss agenda items 5 and 6 under Texas Government Code 551.071, consultation with attorney, and Texas Government Code 551.074 on personnel matters. I just before we close, and just publicly state that I do have a conflict of interest statement, and so I won't be joining the board on the second item around the consultation with the attorney, but will on the personnel matters. So, and I think we're now going into closed session.
Read the two items and then state the date and the time.
Read the actual items themselves.
Are you keeping everybody in the room?
Not yet. So
You've got some people.
let me just do that again. So I announced that
You've announced the basis for the closed session. Just read the item.
the actual item. Item number 5 is deliberation and possible action on the appointment, employment, evaluation, reassignment, duties, discipline, or dismissal of one or more Central Health employees. And then item 6 is receive and discuss a briefing regarding Travis County Healthcare District doing business as Central Health versus Ascension, Texas, frequently known as Seton Healthcare Family, cause number D1GN 23000398. And the time is now 7:08.
Okay. So if I could please get a motion for adjournment?
Adjourn.
It's been moved and second that we adjourn the meeting at 8:40. Thank you very much, everybody.
Thank you.